Okay, members, I declare this meeting open. In the room with me today, I have Robin Newton, Andy Allen and Alex Eason. And on Starleaf, we have the Vice Chair Kelly Armstrong, Sinead Innes and Mark Durkin. So members, we will then begin and we'll go to our first item, which is apologies. Do we have any apologies? Sinead, have you any?
Yeah, Fra.
Okay. Thank you very much, Sinead. Okay, we'll move on to item number 2, Chairperson's business. Members should remember that in last week's meeting I advised as part of the updated COVID guidance, committees are asked to consider essential business only for the immediate future. As a result, we have a number of briefings in the diary that I propose that we cancel and ask for written briefings firstly. So that would be the departmental briefing on its 5-year strategy, the departmental briefing on its 10-year sports strategy, departmental briefing on financial well-being, and the departmental briefing on the definition of affordable housing. I'm just at this stage asking for a written briefing. Once we receive the written briefing, if we feel we want an oral briefing, then we can do that. So our members agreed with that? Yep. Okay, thank you. Then in addition to that, the department has advised that the Audit Office has a draft Code of Audit Practice and summary documents ready for the Minister, and these documents will be laid by the Minister before the 31st of March this year. The committee has been offered an oral or written briefing, and I again propose that on the first instance we take a written briefing on this also. Agreed?
Agreed, yeah.
Okay. Okay, members, we had asked Raise to brief on their paper on a High Street task force for Northern Ireland. Again, can I propose that we keep this briefing on our schedule, but it takes place when we are able to move back to normal business? Members agreed with that?
Yeah.
Okay, thank you. Members, we were emailed a copy of the advice to the committee about meetings on the current COVID situation. You would have received that email came through. It's just to ask for any comment from members on that, or are they content to note? Content to note?
Yep.
Okay. Members, on Tuesday the committee held its second informal stakeholder briefing session on universal credit and welfare reform mitigations. We received briefings from the Cliff Edge Coalition, UCS, Marie Curie and the Women's Regional Consortium. And thank you to the Assembly Engagement team who facilitated the Zoom meeting. And there is a recording of this. It's an oral recording, not a video recording, which is available for members should they wish to listen to it. The event, I think, certainly was very successful, and the committee team will bring a note to the meeting of full committee in due course, and we can decide how we wish to proceed on the issues that were raised. Just to say that a third event will be organised in due course, but that's not likely to be probably until after Easter anyway. Andy, you wanted to come in?
Yes, Chair. As you recall, I raised at the meeting, and we said we'd bring it up here today. In advance of the committee note coming, can we again write back to the department and ask for further clarity on when we're likely to see the proposals of extending and strengthening the mitigations? We're fast approaching the 31st of March deadline. I'm mindful and cognizant that we as a committee have not seen anything. I'm concerned that the Minister may be in a position where she will have to deploy accelerated passage. She's neither confirmed nor denied that, but I'd be concerned if that's a course of action that we have to use.
Yeah, I think that was the overall feeling with all of those involved, and also I think we need to ask the Minister when she's going to have the co-design piece with all of those people who are involved in working along with people, and also people who are on these are in receipt of welfare mitigations. That doesn't seem to have happened other than one meeting with the Cliff Edge Coalition. A lot of the others have not been consulted, so I think we need to ask when that is likely to take place as well. Members, any other comment on that, or are we happy enough to go along as proposed? Yes? Good, okay. Let me see, where am I? Okay, yes, I was in just want to inform members, I was in a meeting yesterday. I was invited along by another MLA to a meeting with TWM where they were talking about the WICT project, which falls under the Fresh Start agreement. It's Fresh Start money that has been running now for 5 years, and it's under the sort of the tackling paramilitarism. And they have 27 projects running across Northern Ireland. They are just very concerned at the moment because there doesn't seem to have been a tender put out for the continuation of these women's projects. And as I say, they are across all of Northern Ireland. They're running and they're very successful in assisting women who are living still under, and we know we still have the threat of paramilitarism in Northern Ireland. We know from recent news reports, certainly, that is rife. So they're just very concerned. Their funding runs out on the 31st of March. There has been no indication if this programme is going to be funded going forward into the future. So during that meeting, it was highlighted with me, and I had said that I would bring it up today. So would members be content for the committee to write to the Minister on this matter for more information on the status of the programme, and if the tender document has been written, and when will that tender document go out? Members agreed?
Agreed.
Yeah.
Chair, just put on the record, I had also recently met with TWN in respect of this issue also, so I'd be very keen that we do that as a committee. And I know individual MLAs have been taking this forward themselves, but any support that we can offer as a committee would be very greatly appreciated by them, and I know for sure.
I think it would be very greatly appreciated by, I think it's over 700 women that are part of this programme. And I think that for those women, they deserve answers as well to know whether or not that their programme is going to continue or not.
I think as well, if we can copy any correspondence, I think that the Department of Justice have a role in this also. So if we can copy any correspondence we send to the Minister, I know that the management of it, from what I understand from the stakeholder or the TWN and others, sits with our department, but I think DOJ have a role also, so if we can copy that.
Yeah, I think the funding comes from the Executive Office and DOJ. I stand corrected if that's not correct, but it rolled out through the Department of Communities, so it's the Department of Communities has responsibility for the programme. Kelly, do you want to come in there? Did I see?
Yes, please, Chair. Yeah. Yes, please, Chair. Sorry. I'm getting a lot of information through that there's an incredible amount of tenders that are in the middle of evaluation. No grants programs seem to be being confirmed. Can we perhaps write, just like this programme, to the department to ask for an update on where they currently stand with all those tenders, because we are coming extraordinarily close to the end of March, and unless we have people who are able to deliver services going forward, we're going to have problems from April. Like for instance, there was word yesterday that the advice sector's potential funding isn't going to be as good in the coming year at a time when it's the most important time for people to have information. The Work Ready Employment Service, the tenders has been evaluated since November. So there's quite a number of outstanding issues there. So with respect to external bodies that are going to be providing funded services, could we maybe get a departmental briefing, a written briefing, just to confirm exactly what's happening there? And it's quite urgent, so it would need to come back to probably next week's committee, given that we're so close to the end of year.
Yep, Kelly, thank you for that. I think that's a good idea that we ask about all tenders that are outstanding. My only concern with some of them is that some of these, from what we've heard, certainly on the Wicked project, the tender hasn't even been written, never mind a tender put out on it. So I think that's good that we ask for an update on all tenders or of any programmes that are due to finish their funding at the 31st of March. Robin, did you want to come in?
Yeah, it's really just to build on what Andy had said around the TWN and the women's programmes. It's really a tripartite because it's a fresh start agreement programme, and writing to Justice I think is very constructive, but I think the executive also need to be involved in it, Chair.
Okay, all right members, can we move on from that one? Yes, okay. I just then want to mention I've attended a few APGs, as have many members that are on this committee, but we attended one yesterday on sports and physical recreation, and I asked the question around the COVID funding for sports clubs for loss of income in bars, etc. Now, they were really very good in their answer, and they did explain that some would receive the funding, and some of them actually the funding will be more beneficial than the funding from the Department of Finance, which is good news. But they did make the point that there will be some of those clubs will be excluded because they don't meet the exact criteria of the sports funding. So it's just, I know we'd written last week, I just don't want to take this one off the boil. So it's just to ask then further to our letters that we sent last week to the Department of Finance and to the Department for Communities to ask about those that will be excluded from the sports fund where are they going to receive their funding from. So members in agreement with that. I have to say it was a really good meeting, lots of information. Sports NI are the secretariat for that, and I know Sinead is the deputy chair on that as well. So there was lots of information given to members of that all-party group on the various funding streams that Sports NI are involved in. So members happy enough with that? Yeah? Okay. All right. And I'm going to move on to agenda item 3, excuse me, which is the draft minutes. Members, you'll find these at page 6 of your meeting pack, and that's the draft minutes of the 21st of January 2021. Are members are content with the minutes as drafted?
Agreed.
Agreed. Okay, thank you. Then we'll move on to agenda item. Thank you. Agenda item 4, matters arising. Can I inform members have been provided at page 14 with a departmental response to queries on phase 2 of the COVID-19 Charities Fund. The department has not made contact with the 129 unsuccessful charities from phase 1 and state that it would not be appropriate to do so, as this could create an expectation they may have a greater chance of success in phase 2. In advance of the launch of phase 2, the department commissioned NICFA to support the sector. It is the Minister's wish that as many charities as possible should benefit from this funding, and the steps taken in the Department to ensure that this is achieved through widespread promotion of the fund. Just to remind members that at last week's meeting it was agreed that we sought a briefing from officials. In the meantime, are there any comments on that? Are they content to note while we wait to hear back from officials about a briefing on this? Content? Yes? Good. Okay. Then, members, also you've been provided at page 16 with a departmental response to queries on liquor licensing holders database. And I think, Kelly, you have brought this up. Advice taken by officials states that there is no lawful basis for the department to hold such information, and without a legal requirement to do so, this would amount to duplication of information and excessive holding of data. The department believes it would therefore be in breach of data protection legislation if it were to hold a database of liquor licensing holders. Members, the Assembly research has brought to the clerk's attention that through her contacts in the Institute of Public Health in Ireland, that the Department for Communities undertook a mapping exercise in 2016 where they plotted the location of all of the off-licence premises in Northern Ireland and by towns and cities. Although it is not the same as the list that had been requested from the committee, I think it would be useful to see the results of that exercise. Kelly, I'll go to you because you had brought this up initially. Are you content with that approach?
Yes, Chair, to be honest, I understand completely the department's rationale when it comes to data protection. As they say, there's currently no legal basis for them to hold that. However, I think in our committee considerations for liquor licensing, I find it astonishing that the department that's responsible for the enforcement doesn't know where all the liquor licences are. So I think that may well be something that we need to take into consideration as the bill progresses and consider that. I just find it incredible that other parts of the UK, the government knows exactly where those liquor licences are, and here we don't. But yes, I think getting access to that map report would be very, very useful. I'm just aware that we've been told time and time again that the rural pubs are vital parts of hubs of communities, but we don't actually know how many rural pubs there are in comparison to our cities. I think it would be a very useful thing to have. Thank you very much.
Okay, thank you, Kelly. Any other member, any comment? Or are they content as proposed that we go ahead with what we want to do? Yeah? Okay. Okay, members, then can we move on to page 17 where you'll find a departmental response to queries on the COVID-19 discretionary support fund. Members, I know this was debated last week at committee, so just want to ask, are there any comments on that? Are they content to note, Andy?
I'm not content to note, Chair. Again, it seems to be the department are doing what they're very good at here and sidestepping the question. I know and appreciate that they can't give us data in the contingency fund in relation to a comparative as to how many people have received or availed of the advance payment and how many the contingency fund, but it's concerning that data is not available, but they haven't provided us with the breakdowns.
Yeah. they haven't. So
Yeah.
do we want to go back and ask for more information? I know it's certainly come up on our brief on Tuesday in our informal stakeholder event about what is the pro forma that they actually use for whenever they're deciding who is eligible and who is not, because we know that we've heard some horror stories about people having to go to their kitchen cupboard and
Further to that,
say
Chair,
what they have.
it's concerning that that isn't in place, given the contingency fund is there specifically in relation to UC, and we're not mapping how many people opted not to take the advance payment due to their circumstances. And we heard those stories on our stakeholder sessions, some of them very, very horrific. And it just doesn't form part of the society that I feel that we should be, the values that we should have. And I'm concerned that the department doesn't have that data in terms of comparative analysis.
Okay, so members then content that we write back to the department and ask for more information on this. Kelly? Kelly, go ahead.
Yes, Chair, I just want to. Yes, Chair, I just want to confirm what Andy has said there. When you look at the eligibility, it comes under loan eligibility. It's to ease a domestic crisis, given the fact that so much money is being returned on the discretionary one. We're not getting the detail of the eligibility for the discretion that's able to be used by officers. As you have said, Chair, the briefing that we received on Tuesday, there doesn't seem to be any rhyme or reason as to the decisions that are being taken by officials on this. There may well be some sort of criteria there, but we haven't been provided with what we asked. The other thing that has me concerned as a committee, we're unable to ascertain whether or not there's equitable provision of the funds, the discretionary fund in particular, because there's no measurements being made. If they haven't got published eligibility criteria that's used by officers to decide who receives, then how are they to measure how effective that discretionary support has been? And I think as part of our questions back to the department would be to ask them to review as an urgent matter the eligibility criteria, to reflect upon that, and if they need to help people, because that domestic crisis, I'm sure a lot of us here have heard from parents with children who are being learning at home, the so-called homeschooling, who are out an absolute fortune when it comes to home heating, because obviously it's winter now and it's a lot colder. Those parents are struggling, but yet they're the ones who are being turned down for discretionary support. If we're to alleviate childhood poverty and the effects of poverty for children, then I would be asking the department for this last period of time, if there's money there to be spent, obviously it needs to be spent carefully, it is public money, but get it out the door and look at to see if the barriers are being created by the officers as part of the discretionary support package or discretionary support criteria.
Okay, thank you, Kelly. Mark, I see you have a hand up.
Thank you, Chair. My camera's still not working, unfortunately for me, but fortunately for you, probably. Now, Kelly basically said what I was going to say, but I think discretion is the thing here. And now I got an answer to an Assembly question earlier this week that showed, despite all the assurances that we've had from both ministers that we've had over the past while, how generous this is and how much better it is than self-isolation grants that exist elsewhere, because only 2% of awards have been £500 or more, which shows that the vast majority, therefore 98%, are below that. So it's little wonder, therefore, not and that's the people that are qualifying, but an awful lot of people aren't, because the threshold is set where it's at. But it would very much concur with Kelly's view that we have to look at, when there is money there that has to be spent this year, at how that can get out to those in real need who haven't been able to access any other support at all.
Yeah, Mark, thank you. Andy, did you want to come in again?
Yeah, just very quickly, Chair. Just for the committee's information, is it perhaps prudent for us also to ask for a breakdown of the wider DS budget since its introduction, and a comparative analysis of how much was actually spent in each of those years, so that we can see how much is actually going out and how much may have been returned to the centre?
Yep, we can ask that as well. Members, look, I'm happy enough with all of that. I just want to ask, are everybody content with all of the proposals that are on the table to go forward with this? Yes? Yeah? Okay, all right then. If members are happy, we'll move on then. Members, again, if I can ask you to turn to page 22, there's departmental response and queries to community transport. Officials have had some engagement with rural community transport in relation to driver training, but to date no engagement has taken place on the issue of funding. I know, Kelly, this is one that you've brought up as well. Have you any comment on that, or are you content?
Sorry, Chair, with regards to, I think sort of missed the point. It's not so much about community transport being funded. Community transport is a part of the community and voluntary sector. They receive funding through the Department of Infrastructure. My concern is that each department treats community and voluntary sector providers differently. So community transport, like many community and voluntary organisations throughout this pandemic, have provided a fantastic service. I know that they're going to be involved with helping people to access vaccine centres coming up, but their money is not ring-fenced within the Department of Infrastructure, as this is found with many other community organisations funded outside of our committee or our department. It's more to see what is being done on a cross-departmental basis from the department to ensure that community and voluntary sector organisations are being treated by government in a similar way. So that if there is a grant funding or tenders or contracts that are coming out for them, that there's no expectation that they have to work to a zero balance at the end of every year, that reserves are recognised in line with Companies House and Charity Commission guidance. So it's more to do with how are the department reaching out across the executive departments to ensure that the community and voluntary sector is being treated the same everywhere. It is this department's responsibility for that. We also haven't had an update on the Concordat agreement negotiations that were ongoing between the department, NICFA and others. It would be good to understand where that is, because that may have an implication for future budget funding for community and voluntary sectors, again, in our own department and other departments.
Okay, Kelly, thank you. Any other member, any comment they want to make on that? No, if not, then the members agreed with the proposals that Kelly set out there? Yes? Okay, thank you.
Thank you.
Okay, thanks, Kelly. Okay, members, if I can ask you then to turn to page 23, where there's a departmental response to queries on the second independent review of PIP. The department is carefully considering the recommendations in the recently published independent review of personal independence payment report, and the formal response will be published in spring 2021. Again, can I ask members any comments, or are they content to note that? Content to note? So, Mark, your hand is still up. I don't know if you want to come in, sorry.
No, sorry, Chair, that's fine. I might come on to it later.
That'll do.
But well, actually, it could come on here. It's something I had raised in question time maybe last week, and I know Kelly has asked questions about it going back a number of months ago, and it was around the assessments, the contract with Capita. Ministers now have given a couple of different answers in terms of their intentions around that contract, and it's integral to this because we know the recommendations were very much the assessments are brought in-house, but and I know a minister had previously said that the contract with Capita was going to be extended for 2 years. I think that's the answer you got, Kelly.
Yeah.
Where I've subsequently got a couple of answers that says it's under review or it's being considered. But if that contract is to be extended, that's going to happen pretty soon. So I think it's important maybe that we maybe write as a committee and ask what's happening there rather than wait to spring 21 and get everything in one go.
Okay, no, Mark, that's grand. Thank you. Members agreed with that? We progress Mark's proposal, yes? Yep, okay, thank you.
Okay.
All right, members, can I ask you then to turn to page 24, where you'll see a reply from the Arts Council to committee queries on IERP. I think, Andy, you had brought this up at our last meeting. There were 1,800 applications to the programme. During the eligibility checking stage, 211 applications were deemed ineligible for reasons including missing mandatory enclosures not meeting ACNI requirements, or the applicant not residing in Northern Ireland. A further 15 applicants have withdrawn from the programme. Details on the number of successful and unsuccessful applications will not be known until the assessment and decision-making process is complete in mid-February of this year, and this information will be forwarded to the committee in due course. So, members, any comment on that or content to note? Content? Okay, thank you. Okay, members, we're going to now move on to the licensing bill. I don't know if we have our witnesses on our screen there. I don't see it. Members, could you double check that for me? Because I don't see them in the audience. Can somebody check that, or am I? Because we can move on to some of our other stuff near the end of there. Yeah. Okay, well, fire on through. Hold on. Do you see where we are? What agenda item number can we go to here? We can go to agenda item 10.
Yeah.
Yeah, okay. Just remind me where I am. Come back again. Agenda item 10, then members, I've asked you to go to there. You'll find this a copy of this SL1 at page 49, and it's the Loans and Mortgages Interest Amendment Regulations Northern Ireland 2021. This proposed rule will make minor changes to current regulations in respect of domestic violence and cold weather payments in relation to the Mortgage for Support Interest Scheme. These will correct drafting errors with the current regulations to ensure that regulations accurately reflect the policy intent. The changes do not change current policies. Can I just ask members content for the department to proceed to make that rule? Yes? Okay, content.
Yeah,
Thank you. Then agenda item 11 is the Social Fund Funeral Expenses Payment Amendment Regulations Northern Ireland 2021. You'll find this SL1 at page 54. As a result of EU exit, amendment is required to the Social Fund Maternity and Funeral Expenses General Regulations Northern Ireland 2005. In the absence of such an amendment from the 1st of January 2021, the Department has no legal basis to award funeral expenses payments to eligible EU and EEA nationals organising a funeral in the UK. Members, again, are you content with this for the Department to proceed to make this rule also? Okay, thank you. Members, then I'm going to actually now move you to agenda item 16. This was late coming in, so it's been put down as 16. You'll find this SL1 in your tabled papers, and it is the Housing Benefit and Universal Credit Housing Costs Executive Determinations Amendment Regulations Northern Ireland 2021. The Department of Communities proposes to make a statutory rule subject to negative resolution under powers conferred by the Social Security Contributions and Benefits Northern Ireland Act 1992 and the Welfare Reform Northern Ireland Order 2015. The purpose of the rule is to freeze local housing allowance rates in cash terms from the 1st of April 2021 following the increase in local housing allowance rates in April 2020. The corresponding GB statutory instrument comes into force today. The NI rule should therefore be made as soon as possible after the GB statutory instrument has been made and brought into operation on the same date. So can I ask members, have they any comments, or are they content for the Department to proceed to make this rule? Content? Yes? Okay, thank you. Okay, we've got... Yes, sorry, go ahead, Karen.
I'm content for that rule to go ahead, but just following on from our briefing on Tuesday, the differential for private renters in housing benefit and rent costs is concerning. I'm just wondering, this phrase, if private landlords are going to increase their rental costs, you know, from the 1st of April, which may be an annual occurrence for some people. I'm just wondering how many more people are going to be in difficulties. I don't know how we find out that information, however. I don't know what, you know, to phrase this sounds like, a good thing, but I just don't know if freezing universal credit housing costs will have a further detrimental impact on people, and especially in the private rented sector, not so much in the social housing. I don't know. Can we maybe ask the department if they could give us a written update just on that?
Yeah, I mean they will hold the database of how many people are in the private rented sector, which we know is a massive amount. So yeah, we can ask those questions. Members in agreement with that? Yes. Okay, members, I'm going to move you back again because our witness has arrived. So I'm going to go back to agenda item 5. Which is the Armagh Cider Company briefing on the licensing and registration of clubs amendment bill. I will get that right one of these days. Can I inform members that the papers for this agenda item are at page 26, and can I offer a very warm welcome to Helen Troughton. Helen, you're very welcome with us today. I'm just waiting on you being brought into the spotlight. There you go, you're with us now. Helen, if you want to begin your briefing, you have a maximum of 10 minutes to brief us. Don't feel that you have to use all of those 10 minutes, just to allow us plenty of time to ask questions. And if you run over, I'll come in and let you know. So Helen, if you want to go ahead, you're very welcome today.
Okay, thank you. I take it you can hear me okay?
Can indeed, yes.
Good, okay. Okay, well, thank you for giving me the opportunity to speak to you today. Armagh Cider Company is a family business which has led the rejuvenation of cider making in County Armagh. Hold on, I've been told to reduce the volume, I don't know how. From being the only cider maker when we started in 2006, there are now 7 others participating at various levels. We make cider from blossom to bottle on our home farm at Ballintaggart. That means we grow the apples, harvest them, press them into juice, ferment them into cider, filter, blend, and then bottle. Cider is different from beer. Cider is wine. It takes time to make. Each year we have only one harvest, that is one opportunity to make the cider for the following year. The apples we harvested in the autumn will not be ready to bottle until late spring this year. That is 6 months in the making, waiting patiently for our crop to be ready for sale. Our ciders are artisan products using entirely local ingredients, employing local people, contributing to the exchequer despite the restrictions placed on us. Local producers are licensed by HMRC to produce the alcohol, meet their strict conditions and pay the excise duty required. But the current legislation in Northern Ireland prevents us from selling direct to the public, and this is stifling investment and growth of our sector. In order to get our products to market, we are compelled to use the services of an intermediary, an alcohol distributor, and rely on them to convey our story and sell our products for us. Indeed, many supermarkets and the larger shops will only deal with distributors and not with small producers. We also do not have the huge marketing budgets of the mainstream brands, which enable them to become household names. In order to get our products stocked in local bars, we have to compete directly against the mainstream brands on margin and volume, which is well nigh impossible for artisan producers. Never mind the other tactics frequently used, like low-cost loans, which leads to the control of a bar's product range, like Tide pubs, or massive discounting, with pallets of product being given away free to ensure that the bar stays loyal to them, excluding everyone else. If we were based in any other part of the UK or Europe, we would be allowed to sell our cider direct to the public from our own premises, as well as at some festivals. This would give us the opportunity to tell our own story and gain some direct traction in the marketplace. At this point, may I add that we and the other artisan cider makers are making quality premium products, which in many cases have won international awards. They are not cheap products. Then we go to tourism. Food and drink are 2 major influences on encouraging tourists to visit. Our ciders are made predominantly from the Armagh Bramley apple, which is PGI status, making them as unique as Champagne or Parma ham, both of which are huge tourism draws for their regions. We welcome groups to visit and see our orchards, processing and bottling facilities. People are interested in the whole process and also enjoy tasting the freshly pressed juice and ciders. However, if you visit any winery or cidery in France or England, after seeing around the vineyards or orchards, you are invited to sample the products and then you can purchase what you like. Here you can visit, but if you wish to purchase, we have to tell you which shops are stocking it and hope that you remember to go along and buy. The chance of some extra income for the producer is gone. By allowing us to sell our products directly to the public would increase the viability of inviting tourists onto our premises. We are based in the Armagh, Banbridge and Craigavon Council area, and the council have been very active in attracting tourism to the area. The Armagh Bramley apple PGI and the indigenous orchards are central to this, along with the Lough Neagh eel, which also has PGI. Armagh has a strong food focus. Creating a local food and drink event or tour is a great way to boost the local economy by creating jobs and increasing tourist numbers. The emphasis of their tourism development marketing strategy of 17 to 22 is to utilise these unique strengths and assets to attract international visitors. They recognise that a key part of the experience for visitors is the ability to learn about the produce, to sample and to purchase at the production premises. They would also welcome the ability for artisan producers to sell their products at festivals, as they believe this would help to attract visitors to the rural parts of the borough. Now, how do I see the situation being improved? As suggested in the bill, a new category of alcohol licence, producers' licences. However, we feel these should only be available to genuine independent producers, not agents. The difference being a producer is the one who bears the financial loss if the product fails during production. At the minute in Northern Ireland, licences to sell alcohol are linked to premises. The prices are extortionate, and this puts them outside the scope of artisan producers. As a producer, we only want to be allowed to sell what we produce. We do not want to become an off-licence or a bar. The growth of our industry will benefit many sectors. Producers, as already mentioned, the apple industry, which is in bad need of support. Like many farming enterprises, it is under stress. With a vibrant local cider industry, apple requirements will increase, and with it, better returns for the growers. Employment. As the local cideries grow, more staff will be required. We now employ 4 people alongside our family, and if producers' licences become available, that number will increase. Tourism. Food tourism is an up-and-coming trend. There are already several established tours available throughout Europe. In France, there's the cider route in Normandy, as well as several wine trails. Cider tours in the UK, France and Spain are worth millions to their economies. Treasury. This industry is already contributing to the exchequer even, by the payment of excise duty. In 2019, there's no point talking about last year, in 2019 Armagh Cider Company alone generated in excess of £50,000 in excise duty, and with little support that will only grow more. However, we do expect the cost of producers' licences to be kept to a nominal amount as in England. Producers are responsible people. We appreciate the need for regulations, and at no time are we advocating the sale of cheap alcohol. All we are asking for is the same facility as the rest of the UK and Europe, to be allowed to sell our products for our own premises and at specific festivals. I hope you, the committee, will look favourably on our request. Any questions, please?
Thank you, Helen. Thank you, and you kept within your time limits, so well done. I think I'm right in saying that you're our first cider producer to come and brief the committee. I think I'm right in that, aren't I? I am indeed. So you're very welcome, and I certainly know, and we did have a previous MLA on this committee from down round those parts who very much was a champion for the cider growers down in Armagh. So very welcome, and as are we all. We are champions on this committee for people who actually have that entrepreneurship to start up businesses, to have a product that will bring in tourism, that will bring in an income to Northern Ireland. So we want to support you on that. I just want to ask you then, you talked there about the issues that you're having, and we know them all too well, these issues of not being able to sell your product. Helen, just how much do you think in monetary terms, and we'll not look at the last year that went by, we'll look at a normal year, how much would you imagine that your losses would be not being able to sell that entire experience to someone who's coming down for a tour, or others who live in and around Northern Ireland that want to buy your product?
It's very hard to justify or to estimate, because with never having been able to, therefore we've nothing to gauge it against. However, all I can tell you is that there are, well, obviously places in England that I'm going to say would be lifting maybe £1,000 a week, but that would be at outside big cities, cideries that are based out there. However, like with us, you're talking maybe a few £100 every week. But again, that just helps. It also, we can't do one-offs, we can't do special items. We're fortunate in that we are in some of the supermarkets. However, whenever we bring out a special brand, the supermarkets won't take it because it's a one-off, it'll only last 3 months. So there's no incentive for us to even try that. And that's one of our problems. So that's where it's stifling us. And during the lockdowns, it's been so frustrating because bars included, the shops at producer shops could continue to sell even though the off licenses were closed, and that was put out everywhere, and yet we were sitting here, we can't do that. And that was to try and help those people keep going. Like, at the end of the day, we're just a farm trying to sell our products.
Helen, just then to follow on from that, you had talked there about producers' licences, and we've heard that from the various brewery or microbreweries and brewers that have come in to speak to us about a producer's licence, and we're hearing more and more how this will enable those businesses to sell their product on their premises, which is right, that they should be able to sell their product on their premises, the product that they make, absolutely. And you'd said that you only want to sell your own product. Are you then asking, as others have asked, for for us to look at the issue around tap rooms? Is that the road that you want to go down, or is it something different that you would like to propose there?
I have no interest whatsoever in a tap room. All we want to do is make the product and then be able to sell it. To me, a tap room, to be honest, I feel is nothing more than a bar. And our cidery is at our home farm. And the last thing I want is a bar on my back door. So, no, I have no interest whatsoever in a tap room. If we were fit to be able to sell our product, if someone came in, like we give tours at the minute, like in 2019, we were the most authentic, we were rated the most authentic Northern Ireland visit by Tourism Northern Ireland. We get a lot of American visitors in every year. Our product is not available in America. They want to bring a bottle back with them. It's difficult to bring a bottle, but having said all that, I can't sell it to them. And it's so frustrating. So last year we not only lost our tourism, but we never did have this, so we didn't have this either. But no, definitely not. I have no interest whatsoever in a tap room. I just want to be able to let the people, by all means, sample it here if they want to sample it, but I mean sample it. I don't mean drink bottles of it. Sample of it and then buy some bottles, take home, enjoy, and then come back again and hopefully buy some more.
Okay, Helen, look, thank you. Thank you for clearing that up. I'm going to open up for members. Kelly has her hand up. Will other members let me know if they want to come in? Kelly?
Thank you very much, Chair. Hi, Helen, and thank you very much for your presentation. Armagh is famous for its apples and, of course, of its cider. I've noted what you've said about, you don't want to have a tap room.
Kelly, I can.
Oh, sorry, can you hear me?
I can now.
Oh, sorry.
Hello?
Sorry, Helen.
Yes.
Thank you very much. Armagh is famous for its apples and its cider. I know that you've said that you have no interest in a tap room. Have you any problems with tap rooms happening in other cideries, wineries, distilleries, or breweries?
No, I haven't. Like, if that's what they want, that's fine. However, I am inclined to say that a tap room, the guys that have pubs are having a hard enough time at the moment. And to me, a tap room is in opposition to a pub. They've paid their rent and rates for years and years and years. I don't want to stand on their toes. I'm not trying to take away their trade. I'm not trying to encourage people to come here instead of go there. I feel that what we're doing should work in a line with both the off licenses and the tap rooms, and the bars, sorry. So I'm sorry, and I just don't see the need for it, because a tap room will end up, I feel, selling other products apart from their own products, and therefore it's not strictly, I could be wrong, it's not strictly a producer's license. I have no interest in selling somebody else's product, because the story is here and it's our products, and that's fine.
Okay. Can I just ask you then, when you talk about selling your own product closed for, to be taken away off premises, at this moment in time, what is the barrier to you guys having your own off license?
Money.
How much?
I've already spent 800,000 putting in a bottling plant, a processing plant and a bottling plant. For me to turn around and spend, it'll cost, where we reckon it would cost about another 100,000 to put in an off license. I don't have it.
Yeah, and just explain to us why that cost. Is it the cost of purchasing the license, or
that's what we're led to believe. And we haven't gone, like, I'll be honest, like, that's what we're told when we inquire. That's what we're told. If we can get if there was a cheap off license out there going, yes, by all means. But like, for all, at the end of the day, we're going to sell. We're only going to sell our own. We only want to sell our own product. I don't want to have the distributor's lorry driving in here and offloading their whiskey and their gin and their what and their what. I just want to be able to sell our own product. That's all. So a full off license is not what I need.
No.
If it was at a reasonable rate, we'd have had one long ago. I have been, believe it or not, most of what I read out to Stormont in 2016. And, things have, like, we started in 2006 and I've been fighting for this ever since. Just please give me a license.
Thank you, Helen. I'm just thinking, obviously you're part of the tourist offer in the Armagh area. And to be honest, you're part of the tourist offer for the whole of Northern Ireland, because there is a need and for us to promote homegrown,
Yes.
foodstuffs and drinks. I'm just wondering, have you any idea at this stage what your value is to the local Armagh tourist market? Because you're bound to be a very good draw for people. One of the reasons why they go to Armagh.
Yes, well, if I told you that last year, in 2020, I had over 100 groups of Americans booked in to come to me. And it's growing every year. And if I said last year, it was probably going to be worth to us somewhere about 30, 40,000. And that was just for the visit. That wasn't any sales. Mm-hmm. We do make our apple juices as well. We make apple juice, and we've just started to make lemonades and tonic waters and things like that. We can now try and sell some of that. But again, as I say, they just love to taste the cider. It's so different from what they get over there. And so, but yes, the tourism definitely is growing, but we need to.
Yeah. No, that's fine. Do you think that obviously when people come at the moment, they can get a small sample? If they were able to take that away, have you had any indication from those sort of foreign tourists? Is there a limit? I believe they can't carry what they have purchased back home with them, so to say. On a plane, that carriage of liquids isn't great. But the export then, I'm sure, must be quite a leading thing for yourselves. Somebody comes along and they sample, and then you can export then obviously to those Americans when they go back home. Is that an issue for you at the moment?
Yes, because I don't have a license, I can't sell either. Because we don't have a license, I can't sell online, and I can't sell to those people to take home with them either. So all I can do is take a picture.
Okay. Oh, thank you, Helen. That was really, really useful. Thank you. Yeah.
No problem. Thank you.
Okay, thank you. Kelly, any other member want to ask a question of Helen? Nobody has indicated that they want to ask any further questions that I can see of. Sorry, Robin, did you?
No, not a question, Chair. I just want to say thank you for the very clear, very concise way in which she has portrayed her business and exactly what she wants out of the application or the perhaps change in legislation. I think I'm completely understanding where she's coming from.
Yeah, absolutely. And I mean, Helen, I know I've travelled to lots of various places where there have been wineries or various other things, and I remember going to one in Georgia and bringing home various cases of different wines that they packaged because they knew it was for their tourist market, and they had wonderful packaging that was very easily put into suitcases without any breakages and everything else. So, I mean, I absolutely get that, especially where you have American tourists that are tasting a product that is, that is something that they cannot get back home. And for them, they would buy in great quantities if packaged properly to take home with them on their flights. So, I mean, I absolutely get that. I think that that certainly needs to change. There's no doubt about it, because we rely heavily on the likes of yourselves and others when it comes to the tourism in Northern Ireland. So, look, and I want to say as well, thank you for being very clear and concise also, and what you've asked of the committee and what you've told the committee. So, can I thank you, Helen, for joining us today? Thank you.
No problem. Thank you.
Bye bye.
Okay. Thank you. Bye.
Thanks, Helen. Bye. Okay,
Bye-bye.
members. I'm just going to propose we just take a very short break to prepare for the next witness. Okay, members, just before I move on to agenda item 6, I omitted to mention something with all of the confusion back and forward there. Just to let you know that the committee's call for evidence closed last week, and we've had over 50 responses, so just to update you on that before I move on. So then I'm going to move on then to agenda item 6, which is Public Health Agency briefing on the Licensing and Registration of Clubs Amendment Bill. Members, you'll find this agenda item at page 32 of your meeting pack. So then can I welcome Michael Owen, who's Senior Drugs and Alcohol Coordinator, and Maurice Mahan, who's Head of Health Improvement. Michael and Maurice are both very welcome to the meeting today. Can I then ask Michael, I think it is, if you want to begin your briefing, and you have up to 10 minutes. Michael? Have we got Michael with Maurice? Definitely. I can see Maurice.
Oh, how you doing? Maurice Mahan here.
Hiya, Maurice.
We've had some technical issues about just getting on audio, so.
Okay. It's all right. It wouldn't be the Committee for Communities if we didn't have some technical issues, so we're well used to that. But we haven't got Michael. Michael doesn't appear to have joined the meeting. Maurice, are you happy to do the brief?
No problem, I can do that.
Brilliant. If you want to go ahead, and sure, if Michael can come in and join us, that would be great. We'll let him in whenever we see him on the screen. Do you want to go ahead, Maurice?
Okay, thanks a million. Okay, so, sorry, excuse me a wee second. I had to run down to get the battery for the phone there, just in case, because we weren't on audio. So if you give me 30 seconds, if you don't mind.
No, that's okay. Go ahead and do that, Michael. We can wait. It's no problem. This is the joy of technology.
Absolutely. Okay, folks. Well,
It's okay.
good morning.
I usually just blame everybody else in the room here. I don't think you'd have anybody to blame there, Maurice.
Well, thanks for being so forgiving.
Oh, with Michael
Okay,
in
so
with
good
us now
morning.
too. There, Michael, you're welcome as well.
Great. So, good morning, ladies and gentlemen. So, my name is Maurice Mahan, Head of Health Improvement of the Public Health Agency's Northern Office. I'm also the agency's strategic lead for alcohol and drugs. I'm also joined this morning by my colleague Michael Owen, who's a thematic lead for alcohol and drugs within the agency. So, on behalf of the PHA, can I thank the Committee for Communities for your invitation to provide evidence on the licence and registration of clubs bill. You'll be aware that the agency, via our Chief Executive, Olive McLeod, has submitted a written response to the Committee's invitation to make a written submission on the licensing and registration of clubs bill on the 14th of December 2020. Our overall view is that any increase in the accessibility of alcohol would put increased strain on resources within health and social services on the basis that increased accessibility consolidates and would further encourage alcohol consumption as a social norm and would lead to increased overall population consumption. In turn, this would be expected to lead to increased negative effects on the health and well-being of individuals, families and communities. Although increased alcohol availability may support aspects of our economy, such as tourism, we agree that it's responsible to adopt a whole systems approach in considering changes to legislation. It has been estimated that in financial terms alone, the social cost of alcohol-related harm in Northern Ireland is approximately at least 900 million each year. This figure would be expected to increase if policies of wider availability of alcohol are implemented. We strongly contend that it is vitally important that the public health messaging of the negative health and well-being effects of alcohol misuse are regularly communicated within a general liquor licensing system. One of the several objectives in the new strategic direction of alcohol and drugs, phase 2, a framework for reducing alcohol and drug-related harm in Northern Ireland, is to challenge the social norms associated with alcohol misuse that drive the drinking culture. We do not support any change to legislation that leads to an increase in alcohol accessibility, as our view is that this reinforces the social norm and increases the risk of alcohol misuse and its harms. In addition, we would support the inclusion of any explicit statement that the protection of public health and promotion of well-being is a key objective of the Northern Ireland licensing legislation.
You still there, Maurice?
Yeah, can you hear me?
Yep, I can hear you. Sorry. We've lost Michael, by the way, but I can hear you.
All right, okay. So also,
Can I
when we
just stop
consider
there?
some of
We
the...
have a withheld number has come through. Could that be? Because we're not waiting on anybody else, but we'll double check that. I'm sorry, Maurice, for interrupting you. Sorry.
Okay, no
Go
problem.
ahead. There's a withheld number we've brought into the spotlight. If you know if you can hear us and you know that you're now been brought into the spotlight, can you tell us who you are?
Yes, I can hear you. My name's Michael Owen. Unfortunately, I wasn't unable to get through on the Starleaf system.
That's dead on, Michael. Glad to have you here. We keep interrupting Morris here when he's in full flow. So I'll come back. Thanks, Michael, for joining us. Morris, you want to carry on? Sorry.
No problem. So no pun intended in relation to the flow reference, I'm sure. Okay, so let's consider some of the alcohol statistics related to Northern Ireland. So 31% of adults binge drink at least once a week, and the source of that is the Adult Drinking Pattern Survey 2013. 18% of adults consume alcohol above weekly limits, Northern Ireland Health Survey 2017-18. And alcohol-related hospital admissions, both for primary and any diagnosis, have also steadily increased for males and females. The same pattern was observed for admissions for the diagnosis of alcoholic liver disease. Alcohol-related deaths have increased over the past 17 years for both males and females. And finally, 40% of children and young people registered on the Child Protection Register, and 70% of those who are looked after children have this status due to parental substance misuse. And the source of that is our hidden harm strategy. So if we also consider any other important evidence produced and adapted by the Faculty of Public Health on advertising and marketing, exposure to advertising has led to both earlier initiation into drinking and heavier drinking by children and young people so exposed. Children are more likely to drink beverages that are heavily advertised, unlike adults who consume a more diverse range of products. The third, the level of intoxication and the odds of drink driving and being involved in physical altercations upon leaving an on-trade venue is doubled by the presence of price promotions. On sales and licensing, there is strong evidence that the price of alcohol is an important determinant in its consumption. A 10% increase in the price of alcohol would lead to a 5% decrease in its consumption. Minimum use unit pricing, which would affect high-risk drinkers and off-trade the most. Moderate drinkers and on-trade would be minimally affected at the proposed rates. Early reports suggest positive effects in reducing consumption of alcohol with heavy drinkers in Scotland as a consequence of the introduction of minimum unit pricing. The PHA would be very supportive of the potential adoption of minimum unit pricing in Northern Ireland, and very keen to follow up with any of you who have an interest in exploring this option. Coming to the end now, so the protection of children and other vulnerable groups. Risks are increased where licensed premises have no restrictions on where families can sit, such as at the bar. The time that families can be present, where the focus is on drinking and where alcohol is advertised. And UK population level studies are clearly demonstrating an elevated health burden attributable to alcohol in areas of higher disadvantage, even though the consumption levels are less. So may I thank you for your invitation to provide evidence to the committee. Myself and Michael are happy to take any questions you might have.
Okay, Morris, thank you very much for that. I know certainly it's well recognised that in Northern Ireland our relationship with alcohol certainly doesn't cover us in glory. And I also know I worked in Armagh Hospital and White Abbey for a number of years, and worked with a lot of people who, as a result of alcohol dependency, needed major medical intervention. So I not only seen the side of that, of the need and the reliance on the health service, but all the side that had on families and society on the whole. So I suppose just the first question I want to ask, you had quoted a figure of 900 million per year. A figure for alcohol-related harm. Do you have any sort of estimate that you would say that this would cost if we looked at the likes of the additional hours or drinking up time, or any of the other proposals within this bill? Have you any estimate of any increase that would be?
Perhaps if I could come in on that, Morris.
Okay, Michael, please.
It's very difficult in terms of putting an estimate on any one of these or them together. However, what we have seen certainly on all legislation in the last 50 years that has increased availability to alcohol, overall population consumption has increased. Now, it's basically absolutely impossible for us to say, would that be by 1%, 2%, 3%? But what we can say is the pattern in every case that where availability is increased, consumption increases.
Thanks for that, Michael. I know that from what and evidence that we have taken, that the vast majority of people, alcohol consumption is within their own home. It's not within our bars and restaurants, and we see that increase more and more. And I think actually during COVID, you'll see that actually will increase going forward, because people have got into that habit now of drinking at home rather than going out, and plus it has an economic benefit to them as well. I know that you had your submission state you didn't agree with the rules around children in licensed premises and the relaxation of that. I would assume it's because you feel that encourages children to see this as something that is normal. Just have you any evidence behind that?
Well, certainly there's a raft of evidence in terms of children and their attitudes. I think often in the agency, what we often say to parents, and being a parent myself of two kids, do not underestimate the power, how your behaviours affect your children's attitudes and values. Indeed, the evidence is clear that children are most greatly influenced by their own parents. So, even in terms of COVID, we were putting out a press release last week, and one of our key messages was about not drinking in front of your children, because again, this comes back to the reinforcement of social norms, where children grow up, seeing alcohol as a normal behaviour as such. So certainly our reservations and concerns around relaxing rules on children in licensed premises would be that this would absolutely reinforce the norm.
Okay. And then I just finally want to ask you around the codes of practice. Your submission highlights that if current voluntary codes of practice were approved by the department, you don't feel that this goes far enough to regulate the industry. What would you like to see around those codes of practice?
Well, first of all, we'd like it to be a statutory code of practice, not industry-led. It's been our experience over the last 30 years, and we have seen industry-led codes of practice on drinks promotions, etc. And whilst these may be followed by a majority of retailers, there is always and constantly a minority of venues where these are ignored. So certainly our experience to date, and certainly in terms of working with the PSNI, is that we would argue that statutory regulation, which is rigorously enforced, is likely to be much more effective than a simple industry code of practice. Our concern also is that if the codes of practice are given some type of approval by the Department of Communities or Government, that they'll be seen as being stronger than they actually are.
No, I understand that. Members, anybody want to ask any questions of Michael or Morris? Can you signal? They're getting seeing hands now. I've got Alex, and then I've got Robin. Alex.
Thank you very much for your presentation. Most presentations we've had so far have been supportive of changing the bill, and yours is quite stark in its contrasts that the problems of increasing opening hours and stuff like that, and it is quite worrying. I mean, the amount of money, 900 million, on health-related issues to do with alcohol, that is worrying. And seeing some of the statistics, 31% adults are binge drinking. I wouldn't have thought that, but obviously, do you really believe that increasing the opening hours by an extra hour or so, it is really going to make such a big difference, or?
I think I would say to you, this is what we call the drip effect. Now, it will, in our view, and we would be very clear in our evidence that every occasion across the last 30, 40, 50 years where availability or licensing hours have increased, we have seen an increase then in overall population consumption. So whilst increase of an hour or a half hour may seem very modest, it has been the drip effect over the years of where alcohol is now more widely available and actually cheaper in terms than 30 years ago, if you look at the economics on that. So, you know, the reason I'm sure we can come across as going, what is the PHA talking about? It's only an hour. What big difference is that going to make? I guess I would say to anyone is go into one of our EDs on a Friday and Saturday night and see what difference it makes. People will inevitably drink more if they have more, if they have more time. Now, not everyone will, but if you take it across over the entire population, we have no doubt that we will see some form of an increase in alcohol consumption.
Okay. Also, you mentioned about if there was a 10% increase in costs of alcohol, that, if I'm correct, it was a 5% in decrease in health issues, or would that be a 5% decrease of the 900 million that's been spent on health?
No, I think this was linked to Morris' introduction, what we call minimum unit pricing. So that again is where, you know, the minimum unit pricing, which indeed is supported by the industry in Northern Ireland, because again, the effect it has, people see it as some form of additional tax, but actually what it is, it's a 10% increase on, basically you're adding to units, so therefore the strongest drinks become the most expensive drinks. Those who are drinking those most strongest drinks, you know, such as very high strength lagers, very high strength ciders, which are currently sold very cheaply, they cause the most damage, both mentally and physically. And you know, you will see it quite often where, you know, particularly where there's alcohol dependency. Someone is trying to get the highest strength alcohol for the lowest possible price. So minimum unit pricing has been shown to very effective in terms of reducing the harm for that most vulnerable group in society who are dependent on alcohol. For the normal person, you know, it would add perhaps 10 pence to a normal bottle of normal strength wine, whereas it has a more significant cost on high strength lagers. So the statistics Morris was referring to is that, you know, we know a 10% increase in the price of alcohol would lead to a 5% decrease in its consumption. You know, if you've looked at tobacco sales, they're quite regulated in terms of the forms of tax, and as we have seen tobacco increase in cost over the years, we have also seen then a subsequent reduction in people using or stopping tobacco. So, you know, the same argument really and evidence applies.
And just to add to that, the early results in Scotland are very promising. So given the adoption in Scotland of minimum unit pricing, it appears to be having the positive effects in terms of reducing high-strength alcohol consumption among those who have been previously seeking to purchase it at the lowest cost.
Okay, thank you. You've given me some food for thought. Thank you.
Okay, thanks, Alex. I have Robin, then Mark, and then Kelly. So, Robin.
Thank you, Chair, and thank Mark Morris and Michael for their evidence. Could you just referred to Glasgow, well, you referred to Scotland there on the minimum pricing. Glasgow and the history of Glasgow in terms of alcohol abuse, it's very, very serious, as I understand it at this moment in time. And there's a connection, as I understand it, a connection between both the alcohol abuse and the drugs abuse in Glasgow. Could you perhaps make some comments on that? Can I maybe just pose another question to you? I'm intrigued by the very last line in your presentation. In addition, we would support the inclusion of an explicit statement that the protection of public health and promotion of well-being is a key objective of the Northern Ireland licensing legislation. Perhaps if you could expand on that. And you didn't respond to the questions around the small producers of beer, cider and spirits. basically where they're looking to perhaps be an asset in terms of tourism. And you didn't respond to that part at all. Maybe you would comment on that as well. And thank you.
Thank you, Robin. So, Michael, maybe could you deal with the issue with the reference to drugs and alcohol misuse and the correlation between drugs and alcohol misuse, if it can be referenced with its in Scotland, but the local profile here?
Yeah, well, certainly Scotland has a long history and relationship with alcohol, as does Ireland and Northern Ireland. Certainly, in some cases, the mortality rates and consumption rates are higher in parts of Scotland there. But equally within the north here, we have extremely high rates of alcohol misuse as well. In terms of the relationship with drugs, they are interconnected. People quite often talk about gateway drugs such as cannabis and whatever. As an agency, we will very strongly tell you the gateway drug to all illicit drug use is alcohol. Every child's literally first experience of a drug is alcohol, because we do forget that alcohol is a drug. It's a very potent drug. It can be a fatal drug. And we forget that because it's called alcohol and we have nice labels and lovely advertising that tells us how enjoyable this is. So, if we look at drug-related deaths, 80% of those involve both drugs and alcohol. Alcohol is a depressant. So if you add in other depressants, this presents a serious risk of overdose, of respiratory failure, of cardiac failure. So the relationship for us is very clear. Indeed, I think I'm not going to speak on behalf of the Department of Health, but I think that's why we have an alcohol and drug strategy. It's not one or another, because as I say, we are alcohol, quite frankly, is a drug. It's a legalized drug, but that doesn't make it an absolutely safe drug. In terms of coming back just to the smaller retailers or the smaller brewers, if I recall, the reason we didn't actually respond to that was the actual question. What impact would you envisage this could have on tourism? We didn't really think that was a question for us to be answering. I don't know. It may increase tourism. It may not increase tourism. Our overall view, however, throughout our submission has been that any increase in availability will lead to increased consumption across the population. On that, Morris, do you want to deal with then just the initial or the last point around integrating public health objectives into licensing laws?
Making life better is our public health strategy. So essentially, we would encourage and invite the consideration of health, public health, and the well-being consideration across all departments and across all policies. So if it is the case that health and well-being are referenced within the legislation, then I think it strengthens the compulsion for consideration of proactive and protective measures associated with health. Because as Michael clearly and starkly has indicated, alcohol, while pleasurable in moderation, is also a very harmful drug taken in excess. And we have the £900 million social cost in terms of courts, prison, hospitals, social care, and early deaths, and therefore the economy are very stark. So in that sense, I think we're kind of increasing with you the sense of the prioritisation of the health consequences of legislation.
And perhaps, if I could I maybe just add a practical example of where the protection of public health and promotion of well-being is included in alcohol legislation, which we have seen in England. And that's where the courts can actually take into account potential public health implications. So, for example, we know, for example, and particularly in areas of disadvantage, they may have higher rates of off sales of public houses within those areas. So courts then can take into account that by issuing a further licence, that may have a further impact, negative impact on public health locally. So that's just an example of how some of that can work in terms of the overall licensing system.
Okay, Robin?
Yes, thank you, Chair. Thank you to Maurice and Michael. Thank you.
Okay, I have Mark and then I have Kelly. So Mark?
Thank you, Chair, and thanks to Michael and Maurice for that. Guys, I fully appreciate your concerns and understand where you're coming from. I wouldn't for 1 second doubt the dangers or the cost of alcohol abuse, and therefore would be extremely surprised if you were vocal advocates for any relaxation of the rules. However, I was wondering, is there any evidence that jurisdictions with similar opening hours to those proposed in the draft bill have experienced worse effects on the health and well-being of individuals, families and communities? I mean, are we in Northern Ireland necessarily in a better position than in England as a direct result of our current arrangements?
Maurice, if you're happy, I'll pick up on that one.
I appreciate that, Michael. I don't personally know how I could reference any evidence around the comparative data.
All right. I don't have the figures to hand, but yeah, I can send them through to the committee if needs be. But it's quite straightforward. Northern Ireland currently has a higher consumption of alcohol for those who drink than those do within the population in England. Now, to put a balance in that, we actually also have the highest rate of abstainers who don't drink alcohol at all. And that's right across Ireland as compared to England and Scotland and Wales. But the point being that for those who do decide to drink, we actually drink more than our English and Welsh counterparts. We drink slightly less than our Scottish counterparts from that. So I don't have instances of specific instances in other jurisdictions that would be, to tie down to exactly the provisions in this bill. But for us, it still comes back to the overall point that any increase in availability, every study has shown that we have ever looked at over the last 30, 40 years, is that we have then subsequently seen an increase in population consumption. I think I described it earlier as the drip effect. We are now at a stage, I believe, certainly in Northern Ireland, where we have allowed so much to be introduced over the years, and some of that has been referred to here. It's not certainly all about pubs or restaurants. A large proportion of our problems now is the home drinking culture and off sales and promotions and discounts, and certainly we did welcome a number of the proposals in the bill, particularly around that area, for example, not getting loyalty points on a supermarket card for alcohol, etc. So, I do apologise. I've lost my train of thought. Can I ask the question again?
That happens to me.
I think well, maybe just when you're considering that, Michael, I mean, Mark, our overall health profile would suggest we're losing 5,500 people in Northern Ireland are dying prematurely annually. Now, there's a lot of factors associated with that statistic, and that fairly extensive loss of years of life expectancy. But alcohol does play a part. It's not by any means the only reason we have significant effects on the wider determinants of health, which highlight the issue about our poverty prevalence and many other social and economic factors. But excessive alcohol intake definitely represents a direct correlation to hundreds of early deaths in Northern Ireland annually. So, and as public health agency, as you indicated at the start, our obligation is to think about how we can protect and improve our health outcomes and reduce health inequalities. So we are obliged to follow the evidence that would indicate that from our perspective, increase in hours, which could lead to increased consumption, would be a negative from our perspective.
And again, I must reiterate, I'm not denying or in any way dismissing the dangers of alcohol abuse, but in terms of the drip effect, and any time there's been a relaxation, or over the years, as there have been relaxations, there's been a trend that shows an increase in consumption. But is that increase in overall public consumption directly related to opening hours? And if we look at the lockdown, for example, bars have been closed for a long time now. Off licenses have been closing earlier. Has that led to a big reduction in consumption?
No, what we have seen through COVID is that for those who have continued to drink, what it has led to is stockpiling of alcohol to deal with the restrictions, both in terms of off sales, closing earlier, and the lack of bars and restaurants. Now, again, it's still early days for us within COVID of trying to work through the alcohol behaviours. We have also picked up that a significant number of people have also made very positive lifestyle changes, including either reducing their drinking or indeed stopping altogether and increasing their exercise. So,
to opening hours.
Mm-hmm.
It's not directly linked to opening hours, is it?
Yes, if you increase opening hours, you increase accessibility to alcohol.
I think in the societal change, I'm not sure that it's specifically related to opening hours. And given your previous answer in terms of the experience in England, where the people here, where we have more restrictive opening hours, the people here that do drink still do drink more than those who drink in England, even though they have more, or they've less restrictive opening hours. So it's sort of, I don't know if you know what I'm getting at, but I think some of the committee might. It doesn't really stack up in terms of the points you're making with regards to what's proposed in this bill around opening hours, in my view.
I think you have to look at the complexities in the whole. We are making the case that if you increase availability to alcohol, we will see an increase in consumption, and we have presented evidence for that. England has a different set of licensing laws, which includes public health measures. There's also differing societal attitudes towards alcohol or to alcohol and how we use it now.
More about those societal attitudes, and than it is about the opening hours, and I know what there's a correlation perhaps between them, but I think the evidence of the lockdown, and I know you have a lot of work to do on that, probably demonstrates that it's not directly related to opening hours. Just another one, and it's a bit similar in terms of, and I can understand and accept the points you're making, and that you don't agree with the relaxation of rules around children in licensed premises, and like children start to see alcohol as normal behaviour. Well, there's a difference, I think, between seeing alcohol as normal behaviour and seeing alcohol abuse as normal behaviour. I'm just wondering, in terms of the experience, again, elsewhere, not necessarily England, but if you look at the continent, where it is very much the norm for children to be in licensed premises as their parents or whoever has a responsible... Is that reflected in terms of them going on? Did they have issues with alcohol, those children? You know, because it's my understanding you are the guys with the knowledge and the expertise in this, that places that are more liberal in that regard actually suffer less, or the population who suffers less in terms of alcohol addiction and abuse.
Well, you made a salient point. It's what children do observe with alcohol. What children observe in Northern Ireland is because of the level of our binge drinking. Binge drinking is much less, for example, in the Mediterranean countries than it is here. So, you know, and alcohol is used in a different way, and a less harmful way, quite frankly. Whereas we have a problem of we have alcohol use used in a more harmful way, in terms that we do have a culture of binge drinking. And when I talk about binge drinking, by the way, it is defined as having 5 or more drinks in one session.
Yeah.
And I know some people say, "Oh, that's not a binge. A binge is going on the whole week." But it you know, that's how we actually define a binge drinking. So and we do have a habit here, you know, again, culture in Northern Ireland, and again, I'm talking pre-COVID here, but, you know, come the weekend and we go partying at the weekend. So this is the type of alcohol use behaviours that we're concerned that children would be further exposed to. So whilst I accept again, the point being that children in other, like, Mediterranean countries, they're observing a different type of alcohol behaviour than what they're observing here, because of the nature and pattern of our alcohol use.
Yeah, but could it be a chicken and egg sort of thing here, or the different societal attitudes maybe down to the fact that the children are able to go and sit and see people drinking responsibly, you know, and whenever you're out, it's generally maybe a celebration or an event or whatever, and people drinking responsibly, rather than children at home, you know, and being exposed to people drinking irresponsibly.
Our key message is it doesn't matter where the child sees their responsible behaviour. Where the child sees their responsible behaviour, you know, that will have, you know, make some form of an impact. Again, you know, it's not just seeing something; it's also about. I talked earlier about how a child is most influenced by their own parents or carers in terms of developing their own attitudes and values around alcohol. It's how we use alcohol in Northern Ireland. We use it very differently from countries like France, Greece, and Spain. And it's, you know, that's actually reflected in our level of alcohol deaths, our levels of liver disease, which is higher than all of those countries. So, you know, that's where I'm trying to come from. It's you know, yes, if children were exposed on every occasion to responsible drinking, that would be quite different. But the evidence tells us that they're quite often exposed to irresponsible drinking.
Yeah, but it just sort of...
And for us, that's the difference.
Conservative or restrictive approach isn't working. You know, it's not working per se.
Mark, you're raising a number of complex areas about the nature of our society and culture and behaviours and so on, and so much of that is likely to be changed by multiple factors in terms. But from a public health perspective, I think we are giving you, I suppose, a firm position based on our analysis. So I suspect then it's up to the committee to then think about the balance of perspectives that you're receiving. But we would be firm in our kind of in our position relative to the other perspectives you will receive.
And I mean, I would fully subscribe to or concur with your view around minimum unit pricing. For example, I think that's bang on, and that's something we definitely have to do. That's not, this bill isn't necessarily the vehicle to do that, but that's something certainly that does need to be done, and we've seen the positive impact of that in Scotland. But no, I'll just wrap up, I suppose, maybe with one final question. That would be that should this bill pass as proposed, you know, I don't expect there will be further amendments. Whilst bearing in mind your opposition, do you think would there be any measures that could help allay your concerns around public health?
Mark, do you want me to pick up on that, or?
I think our duty, I suppose, our formal duty is to give you an analysis based on evidence and health profile, and concerns about alcohol consumption, and the potential risks based on the current proposal for expansion of ours about increased consumption. That's our I suppose conclusion. We are not indicating that. We're indicating that the evidence is that this could make what is a problem already in our society in Northern Ireland around alcohol slightly worse. But alcohol and over excessive alcohol consumption is a public health challenge currently as it is. The issue would be that whether we're indicating that this could make it marginally increase risks to some extent further based on the profile of need that we're seeing that we see as a consequence of alcohol damage. Right, Michael?
It's you know, I guess when you say is anything to mitigate, well, our basic position is not to go ahead with it. But what we have said is that we would support the inclusion of an explicit statement or statements within the legislation with regards to the protection of public health and the promotion of well-being as an overall key objective in terms of any changes going forward.
No, and again, I don't underestimate at all the size of the challenge. It's a massive challenge that we all have to face and take on. But I've just thought of one more thing, sorry about this, folks, and it was I know you didn't comment in terms of the proposals around local brewers and the amendment in that regard. I probably felt that was outside of your bailiwick. But given that, and having heard from a number of local brewers at this stage, that we're talking here generally about a higher value product and a more expensive product. I know you'd said like around opening tap rooms per se would be increasing availability, but given that these are more generally, like I say, expensive products, would that impact on your view at all?
Well, no, not in terms of. I'm not sure I totally understand the question, Mark, but I'll try and address it. I guess.
Ask it properly. I understand it, but I probably just didn't articulate it. If our local beers or craft beers, and with the lady on there who produces cider, are more expensive generally than what is more widely available, would you enter into the market or the promotion of these as they're more expensive? Could it not have a positive impact as well?
Well, okay, yes, I think I'm maybe with your question now. If we're talking about those 10% of most harmful drinkers in Northern Ireland, they'll not be any customers of those type of establishments because they are seeking high strength, cheap alcohol. So, it's very unlikely that 10% of most harmful drinkers in Northern Ireland will be part of the custom. I guess the concern we would have, and I think what you're alluding to, is that because of it being a higher cost product, that we would see potentially a similar effect that minimum unit pricing has. What I would say to you is it's a different customer. The customer who's going for that probably has a greater income and less disadvantage than those that we would be targeting within minimum unit pricing. And I guess the point I'm making here is that your income doesn't protect you necessarily from the level of alcohol you take. If you're if you're going over the weekly units, it really doesn't matter whether you're buying a high-cost product, a mid-range product, or a cheap product. The fact is that if you're going by those guidelines, you're increasing your risks from alcohol-related harm. So, it's very, again, for us, it's just the basic principle that the wider you make alcohol available over the population, and I think it's important to realise that we come at this from a population viewpoint, not specific groups as such, but the overall population consumption, is clearly correlated. That increased availability leads to increased population consumption overall.
Okay, well, thank you. Thanks for that.
Okay, thank you, Mark. I just want to make a point on something Mark was saying there. I think there is a great misconception out there that around other countries around the world, that their issues around alcoholism and alcohol-related harm is not highlighted to the same extent, and especially those countries where alcohol is very accepted as part of normal daily life. I remember reading a paper about Spain a couple of years ago, and their equivalent of the PHA were running a really big, massive campaign for, and I'm not talking about holidaymakers, it's their own citizens, because of the cost of alcohol-related harm in Spain itself. So I mean, I sometimes think we look at these other countries where we see families out for dinner round the table, enjoying a glass of wine with their dinner and all of these other things, but we also see others who are having their breakfast in the morning along with a glass of wine or a pint. And the Spanish government very much had realised that they have major alcohol related issues amongst their citizens, and we're trying their very best to reduce the alcohol consumption within Spain. So I think other countries, we don't often see that side of it. We see sometimes a better picture than that, but it is happening.
I'm not trying to look at that through rose-tinted glasses or rosé-tinted glasses, Chair, but I don't know if that you'd seen what the Spanish PHA equivalent were doing, how much of that problem they, I suppose, laid at the door of the fact that kids could go into areas that served alcohol. I don't know. I know it's very complex, and I don't expect us to answer it today.
I think it's just to say about societal more than anything. Not any. What are the contributing factors to it? But it's just societal issues. And I'm certainly someone who is far from teetotal. I have to say I do like a drink, and I'm not against it in any way. But there are lots of other issues out there that we don't, that lead to these problems that are not necessarily, as you were saying, Mark, or you can't pin them down to one thing is the contributing factor, But sorry to butt in there. I know I have Kelly waiting and I have Andy waiting as well, so I'll go to Kelly. Here's Kelly. No, we haven't ring Kelly in. There we go. We've got her.
Hello. Thank you. Thank you very much, Chair. Thank you very much, Maurice and Michael. To be honest, I have been waiting patiently on this type of evidence coming through. It is a vital part of our considerations. We know that there is alcohol abuse within our society, but we have alcohol in our society. This licensing law is not going to remove alcohol from it. So I just wanted to ask you a few clarification questions. You're absolutely right. We do use alcohol differently than Mediterranean countries. And I remember back in the dark ages when I was at uni, I remember reading a study about Northern Ireland, and I don't believe it has changed so much in all those years that the way that we drink alcohol in Northern Ireland is different from other places. And while we may drink less than Scotland, what we tend to do is, instead of going to the pub at lunchtime and having a half pint while you read your newspaper, what we do in Northern Ireland is we save it all up for a Friday or Saturday night, and when people go out drinking, they mean it, and it normally ends up in quite drunken behaviour. Now, there are people who can drink safely and respect alcohol. So I'm just wondering on the clarification point in this document that you have sent us, which is really helpful. You've talked about you're not interested in any changes to children being in bars or the extension of drinking time or the extended licensing hours. But I was just wondering, in your analysis, have you looked at how we could do things differently by accepting that alcohol in society, and in order to manage that alcohol better in society, we consider things like promoting children seeing responsible drinking. What would be, it would have been useful to see as part of the licensing regime some sort of an enforcement clause, like PHA suggesting ways that we could bring in enforcement issues. So if a bar or a licensed premises continually has issues at closing time or throughout the evening, that there could be an enforcement issue brought in with the license, that the license then could be revoked or limits put on that license. I'm just wondering, is there anything from your analysis that looks at it not just from saying no and saying that these things are not a good idea, but that actually says this is how we need to work with this alcohol that's in society?
Morris, do you want me? I'm sorry,
Yep.
Morris and I are both on phone, so it's hard to see each other, or we can't
Yep.
see each other.
Okay.
Do you want to pick up, or would you like me to respond?
No, go ahead. Well, Kelly, just I think we're pleased to know that at least the robust evidence and the robust position that we're representing here, at least as a firm consideration for you. Very happy to further clarify any of the evidence and research references or the prevalence issues or the consequence issues, because they are severe. And if it is the case that we are all as a society trying to turn the curve in terms of our overall direction of reducing early deaths and increasing life expectancy, particularly for those who are going to be at greater risk associated with increased alcohol consumption, then much more needs done. So, and our position is solidly pointing the committee to the consequences of alcohol legislation currently and the risks associated with some of the measures within the proposed bill. Michael.
Again, Kelly, thanks for your comments. I think that the two key strategic drivers for ourselves, one would be minimum unit pricing, which we've already talked about in this discussion. Certainly, we believe the evidence is clear on that in terms of reducing harm for those most harmful drinkers in our society. And again, we're encouraged by the results and evaluations that's starting to come out of Scotland on the terms of the effect of their minimum unit pricing. I think the other strategic area for us, and again, I'm not sure perhaps we have explained ourselves well enough on that, is the introduction of promoting public health and well-being as part of an overall legislative framework. Now, by that, I guess some of that is where we've looked at other areas, such in England, where public health is incorporated, and I know their licensing laws are different to ours, but again, that has allowed where perhaps you have, I don't like to use the term, but a problem bar or a repeat offender where, you're regularly having issues at closing time, antisocial behaviour, underage drinking, the whole raft of things that you can see. There, the local police, the local courts, in terms of responding to those and looking at the issuing of licences. So public health are having a direct input then in terms of localities and of being able to manage issues around where establishments which may be poorly managed, like one of our pieces of legislation is that someone should not be served who's intoxicated. We've all been in bars where we've seen people who are clearly intoxicated continue to be served alcohol. So I think for me, that's the two key issues, or for the agency, it's the two key issues, is the minimum unit pricing, which we believe will have an absolute positive impact on a population approach, and the greater involvement or input of public health into licensing, both licensing legislation and decisions.
Yeah, it's interesting on that one because I noted your response about the voluntary codes of practice, and rather than being voluntary, that they should be statutory. That that's what I wanted to tease out from yourselves. Do you believe that the PHA, or is it the trusts, or who is it? If there is a code of practice and it's a statutory code, who would it be from health that would have an input into that? And I'm assuming, I don't want to put words in your mouth, but I'm assuming you would like to see that code of practice would be reflected upon at licence renewal time, or if there's an enforcement issue.
Well, absolutely. We would believe that would be part of the consideration of relicensing in terms. Now, when we talk about that having statutory approval, obviously in terms of enforcement, that would be an issue for criminal justice colleagues. But absolutely, the PHA would be more than willing to be involved and assist in terms of developing those guidelines. The point for us is we believe it needs to be have a statutory basis. Our experience, both as a public health agency since 2009 and previously as health boards, is that voluntary codes of practice rarely are rarely as effective as a statutory code of practice with rigorous enforcement.
Yeah, I'm just thinking in particular, for instance, I don't know, at this moment in time, you can advise me on this. We could have bars, doesn't matter where they are, at time, drinking up time, and when people leave the bar, where you could have an ambulance outside. There's violence maybe on the street. There's people who are very intoxicated. We obviously know about, sadly, attacks that happen, whether they're sexual or physical. As far as PHA is concerned, is there an easy way for that type of external behaviour to the bar, the licensed premises, to be collated, or would that need to come from the police as opposed to from yourselves? I'm just thinking about the pressures that are put on the ambulance service, the A&E departments. Would that be able to be, if this was a statutory code, would that be the sort of information that would be easily available without creating too much cost or too much pressure for the PHA to be a statutory advisor, or have a statutory role in that statute, in a statutory code?
Morris, do you want to?
Yeah. Well, I think in the context of the adoption of the statutory measures, we would very certainly be seeking, obviously through clarification of our role and roles relative to the Department of Health, we would very much invite involvement, because the opportunity to bring together, accident and emergency data, ambulance data, alongside policing and justice colleagues, alongside the Department of Communities, for example, that joined up thinking about cause and effect and whether there's a localised problem and localised solutions would be incredibly better joined up dialogue, I think, between public health, industry, and criminal justice and policing.
And do you think that would help license the person who holds the license then to consider the impact, so that if someone does turn up, as you say, intoxicated? To be honest, do you see, if I turned up at a bar and had a pint of cider, I would be intoxicated because I'm not a big drinker. At that level of intoxication, it's not a case that they breathalyse people, because you could breathalyse me and I could be completely out of it and not having had an awful lot, whereas somebody else maybe can cope with an awful lot more alcohol than I could. But I'm just wondering, if there was that impact on their licence, do you think that licence holders then would take foot? A lot of them are quite responsible. I'm not going to say that they're all terrible, because they're not. But I'm just thinking of those areas where there are, outside the bars and.
I think it's very, very helpful consideration about the actions that would be incumbent upon the licence holder. Some of those actions may be beyond the licence holder. We know, for example, that we are seeing a shift in preloading, as young people call it, behaviour, so that people are consuming significant amounts of alcohol at home before going to bars. So all of the responsibilities may not be on the bar owner, but the consequences of someone being drunk are significant numbers of people, continuing to receive alcohol in a site, and the related behaviours that might be seen outside of the licensed premises. I think that that would possibly shift the dynamic around cause and effect.
And can I also ask about off licenses? Now, I live in a rural area and there are off licenses sell a range of products, but there's always an issue with young people getting access to alcohol that has probably and normally has been bought for them by an adult out of an off license. I'm trying to think there with regards to licensing of off licenses, because we have been asked about extending off license, licenses to other premises, like for instance some of the people who we heard from earlier today. I'm just wondering, with that off license, then, do you think that there should be some sort of a statutory code of practice with regards to off licenses, that if that off license fails to deliver or fails to sort of manage who's buying alcohol, that they could lose their license too, and PHA could have a role in that?
Michael?
Yeah, well, certainly we would have tremendous concerns with regards to off sales because we know that's driving a lot of the home drinking. Morris talked about preloading there. Certainly the culture of younger people now. I hate to show my age over the phone, but in my day, if you were going down the pub, you went down the pub around 7 or 7:30. They tell me now that basically they don't arrive into the pubs to 10:30 or 11. And can be already well stacked up. And I would come back to minimum unit pricing. A large amount of those drinks that young people are stocking up with are high alcohol, cheap alcoholic drinks, and minimum unit pricing would have an impact there as well. I do have a sympathy for the level of policing that we perhaps expect off licenses to carry out. I think it's very clear that we're obviously where a person is clearly buying alcohol for a young person, that we would expect staff to have adequate training and being able to deal with that and refuse sale. But equally we're aware, unfortunately in some cases, of parents buying alcohol for their own children, and others. We're aware of illegal alcohol sales to young people via various routes and road taxis, whatever you want to call these things. So certainly off sales, I think a lot for us as an agency perhaps is how off sales staff are trained to recognise potential problems, trained to implement a code of think 25 or think 21 in terms of seeking IDs, and also again recognising where there is potential for someone maybe buying alcohol for someone underage. But again, I think certainly I would agree, Kelly, that if an off license, a particular off license in a particular area, is repeatedly ignoring those things, then for me it is an enforcement issue. And that, with a statutory code of practice where someone is just obstinately ignoring it, that actually effective action can then be taken in terms of either moderating or adapting or removing that licence for that business.
And finally, Chair, thank you very much. Morris, I wanted to ask you something. So if this legislation proceeds as it currently is set down, where the extended times, happen for bars being open and the drinking up time, that effectively moves, say in Belfast city centre, it moves people coming out at around 1, 1:30, 2 o'clock later. And I'm not going to ask about the money because it's finger in the air for that one, but I'm thinking about the pressures on A&E departments. So we will still have people who will not be able to cope with the alcohol that they have consumed that need to leave a bar at 11 o'clock, as we will those that come out at 12, 1. But if we take it right through to 2 and there's people knocking around at 3 o'clock in the morning, I'm just wondering, anybody who's been to A&E on a Friday or Saturday night knows that they're in for a long wait. There's normally lots of police there. There are people who are intoxicated. There can be violence. But I'm just wondering, what is the human impact in any departments for that period of time to be extended? Is it just a little bit more, or are we expecting, another 20% of additional pressures? I'm just trying to work out if it's just more of the same, or
Kelly, I would say that you're right to say that there will be an inevitable correlation between the later closing times and presentations to action and emergency. Whether those are going to be worse or more intense as a consequence of increased consumption, I think we have indicated our concern that there could be the issue about impact and flow into action emergency will certainly have an effect within action emergency departments, ambulances and policing. But again, I can't fully quantify that. But there would be an increased risk in terms of the alcohol consumption, the potential kind of disorder and violent implications. Those are there. We are seeing some of those challenges associated with weekend drinking in city centres, town centres. Those are being managed currently within current process. But later hours will shift the times that you will see increased presentations to action emergency. There's no doubt about that.
Can I just ask, and excuse my ignorance on this, but shift patterns within A&E and hospitals, I'm just thinking, I take it staff come on, I don't know what time, say 11 o'clock, and they would be right through until whatever time. Does it cause an issue with shift patterns, or is that okay the way it currently stands?
Kelly, I think, Michael, have you any thoughts?
Yeah, Kelly, it's perhaps difficult for us in the PHA because we're not the commissioners of services within ED, so we wouldn't necessarily have that level of information. That would be with the Health and Social Care Board. But being a registered nurse myself, and in the past, and knowing colleagues in EDs, well, shift patterns are different. Certainly, the traditional night duty shift pattern is a 12-hour shift, 8 to 8. But obviously, local EDs, in terms of their own staffing pressures, I would imagine would be very much perhaps adapting their shifts around pressured times. Anecdotally, talking to my colleagues, and again the trusts, each of the hospital trusts and or the Health and Social Care Board would be better placed to comment on this. I'm not sure whether you're hearing from them or not, but certainly I guess at the minute when you speak to colleagues, that they talk about the worst of the night tending to be over by 3 or 4 a.m. Whereas beforehand, as the bars start to empty, the nightclubs start to empty, they know they're looking at that 3 or 4 hours of not just dealing with those seriously ill people, maybe with cardiac arrests or heart issues or car accidents, but also a level of very much alcohol-related casualties. Unfortunately, some of those casualties will be abusive, both verbally, both physically, and yes, that is a pressured area where you're working. And I'm 35 years in the health service now, and I remember starting off in casualty and in those days, and I've watched levels of abuse and threats and physical violence increase almost year upon year, and certainly the vast majority of that all linked to patients who have consumed alcohol and in most cases are intoxicated.
Mm-hmm. I'll not take up any more of your time just in case anybody else needs to come in, but thank you very much to both of you. As I say, it was something that I have been patiently waiting on us getting evidence for and about, because it is the side of licensing and alcohol that we do need to be cognizant of and to balance whenever we're making our considerations. So thank you very much.
Thanks, Kelly. There certainly are people waiting to come in. We've got Andy and then we've got Sinead. And can I just, on a point that Kelly brought up there, to do with getting evidence from the trusts, etc. The Chief Medical Officer was asked to come in and brief the committee, but due to COVID pressures is unable to do that, but is sending a written briefing, so just to let you know that. Andy, yourself, and then Sinead. Andy.
Thanks, Chair, and it'll come as no surprise, Martin Kelly covered the majority of the points that I was going to make. Can I just ask a quick question in relation to the adult drinking pattern survey 2013, which you've referenced in your consultation response? Is there any more up-to-date data? I think when we received research briefings, it was indicated that there isn't. Some of the data in that is very useful, but it'd be much more helpful to see the current trends, and I do appreciate obviously COVID will have somewhat thrown a spanner into the works in respect to that.
Again, that's something we're in discussions. Most of our surveys are undertaken by the Department of Health and Department of Education in terms of children and young people. Certainly, I'm looking at that myself, and I'm sorry, having been the person who filled in this paper, I do want to go back and check if we have any more prevalent data, because I'm pretty sure we do. So I have to hold my hands up and say that may be an error on my part. But if your people are happy with that, I'll take a fresh look at the statistics and undertake to come back via the clerk or the chair of the committee.
Yeah, no, that'd be
Andy, just one point would be that it is everything's being affected by COVID at the moment, but the 10-year census is planned to be undertaken in March of this year. That is a really critical kind of platform for data and will include some health or behaviour questions and alcohol questions. So we can certainly then review to determine the questions that are being asked as part of the census for 2021, the alcohol-related kind of questions that are going to in there. But that we certainly are in for what will be very important, comprehensive data that will flow from the 10-year census due in March 2021.
Thank you very much. And you know, it's important to obviously lay out that I for one don't underestimate the impact of alcohol-related harm, and when it's taken in the wider societal context. And I think looking at the survey data that's been presented, and in your consultation response, you know, you've highlighted binge drinking and obviously the drinking within the pub environment. But I suppose it would be true to say that looking at those survey responses, perhaps the greatest and most significant impact that we faced is the alcohol consumption within the household, and that's not to pit pubs and restaurants against that consumption within the household. But would you agree with that? Would you agree that within the household, that is where we face our most significant problem?
I think you've described it as in the household, and from that perspective, we would agree with you. It is the home drinking, but the source of the home drinking is off sales. So, you know, sometimes I think we kind of lose the focus when we talk about home drinking, because what we're actually talking about is off sales, and there is no doubt that the advent of increased off sales via the supermarkets. Alcohol, as I said earlier, now being, you know, in terms of the economics being cheaper than 30 years ago, that has certainly fueled an increase in the use of alcohol over the last 10 years. You know, but also it should not be under-influenced or underestimated the power of alcohol advertising. Certainly, you know, women are now either equal with their male counterparts or out-drinking their male counterparts in some type, and we can correlate that to direct industry advertising targeting women over a number of years. Again, we can also see, whilst young people are overall drinking less than they have been in the past, those who are drinking in a more harmful way. And again, it's quite easy to see in terms of how the industry have targeted young people over the years, particularly with the introduction of you know, what would traditionally be known as the alco pops type culture. So whilst home drinking is a major matter of concern for us, it's the accessibility issue argument to come back to again, that, you know, we've seen a wider accessibility to alcohol through that off-sale expansion and the reduction overall in price, and therefore we have seen an overall increase in consumption in the population.
No, that's a fair point, and I suppose, and I know you've been asked this by previous committee members, Kelly and Mark, and in dealing with that, and what one aspect would be minimum unit pricing, but and you'd highlighted advertising. Are there other considerations in respect to that we should be looking at?
I think we referenced the promotions, the use of promotions or reduction of alcohol within promotion within bars it seems to be problematic in terms of the risk of significant increased consumption linked to promotions.
Yeah, and just a final point, and Mark, you'd be glad to know that I got your line of questioning in respect of the points around the availability and increased opening hours, and I'd be very keen to see that data from across other jurisdictions, because I would like to be able to compare that, because I think it was teased out through that dialogue, our societal patterns here in Northern Ireland, and I think COVID has displayed that in respect of where we are, but I'll leave it there, Chair.
Thank you. Thanks, Andy. Then I'll bring in Sinead. Hi, Sinead.
Thank you, Chair, and thanks very much for your time today. It's been very, very useful. I suppose Mark and Kelly have covered an awful lot of it, and like Andy, I suppose I got Mark's line of questioning and probably concur with a lot of what Mark has said. Just a small, quick point. I don't think it's been mentioned yet. Because this bill proposes to increase the number of licences for major events, and would the PHA have a specific view on that, or any risks or any harms associated with those type of events specifically?
It would come back to Morris. You may want to come on this. For us, it's the general principle of increased availability. And again, I suppose it depends what we're talking about in terms of major events, because there can be a number of very different aspects of different events. So, again, I'm thinking of the festival culture in terms particularly of young people, where we know that there's going to be an audience that both there will be issues around alcohol, there will be issues around drugs. But then as you compare that as to an event like the Open in Portrush, I hope that's perhaps me trying to make a point that when we talk about a major events that there may be differing, but overall, again, if our legislation was introduced or didn't get through in time because of whatever reasons of where the Open was looking to I think sell alcohol, and again it seemed to be from that point of view. But for us, the key question again is that no matter what the source is, whether it's a major event, whether it's a small event, whether it's off sales or whether it's a pub, our basic principle is that if we increase availability, then we will inevitably see some level of increase in overall population consumption. Morris?
Yeah, I don't think I have anything else further to add. I think we'll work on that principle. That our key point is that where you have increased open hours, there is a risk of increased consumption, and I think there's points have been made here that we will certainly be happy to work with you on around whether there's any comparative data to show that the increased hour has any statistical increase in consumption, but in other jurisdictions as comparators, but that would be our bottom line concern.
Okay, thank you.
Thanks, Sinead. Just before you go, can I just ask you one last question, and it's to do with the various campaigns that the Public Health Agency are involved in, whether that's radio or television campaigns or advertising. Is there anything at the moment ongoing to do with anything related to alcohol consumption, any campaigns?
We have no specific campaigns at the minute. You'll appreciate our communications team are very much, everything this year has been pretty much around messaging through COVID. Though through part of that campaigning, we have used blogs, we have used social media, we have used press releases most recently, only last week, on terms of the further lockdown, and particularly focusing on not stockpiling alcohol at home. We continue to regularly, and by that I mean on a weekly basis, use our social media channels, and we can target very messages there to specific portions of the community in terms of alcohol and both drugs. As part of our COVID response, and Morris, you may want to pick up on this, we have published regular blogs through our website, and a number of those have included advice and guidance in around alcohol. And as ever, we do have a range of published communications which can all be downloaded from our website. That includes, talking to your child about alcohol. It includes alcohol and you, and we also have there's links there then to our drug and alcohol website, where there's a wide range of resources, including all services that can offer help to someone who is having issues with alcohol or drugs in your local area. And as MLAs, I would really strongly suggest that you be aware of that, particularly of being able to signpost your constituents who you may be coming into contact with, because quite often we're told there's no help there for drugs and alcohol. There is, and there is in every trust area across Northern Ireland, commissioned both by ourselves and the Health and Social Care Board.
Okay.
So a component of our focus and messaging is on family support, a very holistic approach to prevention and support and increased risks that exist during COVID. But many of those risks for families do pre-exist, predate COVID. So we have been focusing our family support around ensuring that we are picking up families who may have concerns around increased alcohol consumption. We know that we definitely have strong data around increased domestic violence during the lockdown. And we know that excessive alcohol consumption is a factor associated with that increase in domestic violence. The short answer is we have no formal TV or poster campaigns going on, but as Michael has indicated, we are using blogs, social media, press releases, and we are certainly maintaining key messages and guidance around alcohol and drugs.
No, look, thank you for that update, and I do understand that COVID has taken precedence, but one of the results of COVID is the amount of alcohol that's being drunk at home at the moment, and as you say, that has led to other problems, whether that's domestic violence or domestic abuse, or safeguarding issues with children and various other issues. And I just say it because I know that any of the campaigns that the PHA have been part of have been really very good campaigns and really hard-hitting and are so effective in getting the message home. So it wasn't a criticism for not having any done, because I know that you do it so well. I have Robin, who just wants to ask a quick supplementary, I think, on that. Yes,
thank you, Chair. It's on your first point you raised, Chair, the cost of 900 million a year on the social cost of alcohol-related harm. You'd made just some comments there, Maurice or Michael, about the domestic abuse and child abuse. Does that also, that 900 million, does that include that area as well, or are there additional costs?
Yes, the 900 million will be partly made up of the cost of those who would be imprisoned as a consequence of alcohol-related offences. It will also take account of the loss of employment as a consequence of years of life lost, and the direct cost of interventions associated with health and social care and accident emergency. Michael, are any other components of the 900 million?
I'm sorry, I don't have them right in front of my hand. The figure actually is from Northern Ireland's drug and alcohol strategy, as part of their context, which is currently being reviewed and due for publication this year. I would imagine that the CMO's briefing will make reference to that, plus any updated figures. But certainly I will pull out the full list from the strategy and send it through to the chair and or the clerk of the committee, because certainly there's a wide range of components of which Maurice has referenced there, but I just can't be 100% sure we've covered everything, Maurice, so I'd want to double check and just resubmit it to the committee.
Robin, maybe as a bounce off from your question, the point that Michael made there is that the Department of Health have now issued their substance use strategy, including alcohol and drugs, which is designed to be an interdepartmental strategy, which will carry us forward for the next decade. So there maybe is a key opportunity now in terms of our conversation today around some of the issues about the introduction of health and wellbeing within the statutory legislation, and some joined up thinking between Department of Communities and Department of Health via the substance use strategy about how we could maybe achieve some of those measures within legislation. So a key window is open. Maybe the opportunity for consideration of some of those measures, including minimum unit pricing and so on. There might be a set of issues which are raised overall that certainly would be very productively could be routed through to the Department of Health in the context of health strategy.
It certainly would be my intention to ask the Chair about the protection of public health and promotion of well-being as a key objective, so I certainly will follow up on that one.
Okay, look, thank you. I think that is everyone. We went on for much longer than anticipated there in that briefing, but I would just want to say very much thank you to Morris and to Michael. I've said it at other evidence gathering sessions that we really do need to have a balanced approach as members when we're looking at this bill, and that includes actually hearing evidence from everyone who's involved in anything to do with this bill. So look, thank you guys for coming to us and for answering all the questions so in-depthly as well.
You're very welcome. Listen, very happy to follow up and wish you the very best. Thank you very much.
Thank you. Thank you now. Bye-bye.
And from myself as well, thank you all.
Thank you. Bye-bye. Okay, members, we're going to then move on to agenda item 7. I know certainly...
Chair, could I just before
before we move on, sorry.
Yeah, maybe just on that very last point, very last 2 lines within the presentation, could we maybe ask the bill team to have a look at that phrasing there and what the implications might be?
Absolutely, yes. Yeah, we'll do that. Absolutely, Robin. Okay, members, I'm going to move on because I'm quite conscious that our agenda item 7, our witnesses have been waiting almost an hour to come in because that did run a little bit over, and you don't understand, members, the pressures that puts me under then as chair to try and get this meeting finished in time when we have 2 departmental briefings as well to come ahead, and I certainly want to give Omniplex their opportunity. So if I could ask members to go to agenda item 7, where we have Omniplex Cinemas briefing on the licensing and registration of clubs amendment bill. Members, you'll find this item at page 38 of your meeting pack. Can I offer then a warm welcome to Paul Anderson, who's Managing Director for Omniplex, and Carol King, the Business Development Manager. I think, is it yourself, Paul? You're both very welcome, but I ask you, Paul, if you want to begin your briefing, and you have up to a maximum of 10 minutes to brief us.
Can you hear me now?
I can indeed, yes, Paul.
Oh yeah, great. Firstly, I'd like to thank the committee for allowing us to speak today and put our views forward in relation to this amendment bill. Where to start? I think to begin with, who is Omniplex? Some of you may be familiar in Northern Ireland of Omniplex Cinemas. We are, and this isn't to kind of pat us on the back, but we are the largest cinema operator on the island of Ireland. We operate 33 cinemas on the island of Ireland, 15 cinemas in Northern Ireland, 18 cinemas in Southern Ireland. We would sit on a lot of the boards of international committees such as NATO, the National Cinema Owners, National Association of Theatre Owners in the US, on their international committee board, and UNIque, which is the European Union of Cinemas. So we'd have a fairly broad knowledge of the markets in relation to cinema, what's out there, what's changing.
Oh, Paul, you seem to have frozen on us. Okay. Carol, do you want to do a little bit of a brief while we wait on Paul getting maybe back in?
Yes, I can do
it. Yeah, go ahead.
Can you hear me okay?
Yeah,
can you
Carol?
hear me? Yes. Well, just as you know, Paul is saying, is that we are globally, we're very much involved in the cinema side of things. Omniplex 2 is very much about community, which obviously Department of Communities, ties in with yourselves. We're very much looking at, if you look at all where we have the cinemas within Northern Ireland and Ireland, it's all community based and not just high town kind of things.
We've Paul back in again. If Paul, you want to
Apologies
pick up
about
again, go ahead, Paul.
The benefits of technology. Apologies about that. So where was I? Yeah, so we have fairly broad knowledge of cinema and what's happening in different markets. And just to summarize, that's just a summary of who we are and I suppose our knowledge of the direction of cinema. We're seeing a massive trend towards cinema being more of a luxury experience. Definitely in the UK, it is taking that direction. A chain called Everyman Cinemas is really leading that element. Part of that offering, a large part of that offering, is food and beverage, and key to obviously the beverage element is having a license to operate and sell alcohol on the premises. That would, not having a license, Everyman would not be able to function. That is key to their business model, and they're very successful, and the trend is going towards that direction. We actually have a alcohol license in one of our locations in Dublin in Rathmines, which is a 9-screen cinema, and in the south of Ireland, we are able to achieve a license through a theatre license. So we apply for a music and entertainment license, and on the back of that, we are able to achieve a theatre license, which is normal, standard, and a lot of other cinema operators in the south of Ireland have done that. To date, we've had no issue of note with our license in Rathmines. We've had it for the last 2 or 3 years. We have a kind of a bar area, and it's quite casual. People may have a drink before or after a film, or they may bring a glass of wine into the theatre itself. A lot of our opera guests would come in and avail of that, and they love the offering. And in the mainland UK, in England, Wales, Scotland, a similar way of applying for a license is the same as Southern Ireland, that you can apply for a license through a theatre license or the equivalent of. So England, Wales, Scotland and Republic of Ireland, cinemas all have the ability to apply for a license through a live entertainment license or a theatre license. So where does that leave us in relation to Northern Ireland? We're a big operator in Northern Ireland. We believe in the Northern Irish sector for leisure and entertainment. We've made massive investments in Northern Ireland, and in order for us to evolve and for the offering to grow, we see the need for an ability for us to apply for a license. That doesn't say that every single cinema that we operate in Northern Ireland is going to get a cinema license, an alcohol license. It's not. It would be a select number of locations that we may consider applying for, and that's really why we're kind of presenting to the committee and putting our case forward that we see that for the future development of cinema, and in order for the luxury element, which is definitely the trend, Northern Ireland, we don't want Northern Ireland to be left behind, and we don't want to be at a lesser competitive advantage to other areas such as Scotland, Wales, England, or Republic of Ireland.
Okay, Paul, thank you for that, and thank you for Carol having to sub there for a little while as well.
Yeah.
I'm very familiar with your cinemas, and I have, as I was last week, also with Michael with the movie house, and I know that you will have listened to the briefing there, and we'd raised the issue about the level of demand. But I suppose this is slightly different to your briefing because, Paul, you have experience of where this has already been successful in your outlets down in the Republic of Ireland. So do you feel that there is the same demand here up in Northern Ireland for that offering? And also then just to ask you around how that would work then for licences for cinemas. Is it a specific category, or what category will that fall into, and do you know what that would cost cinemas? Because I know it asked last week about the cost of a licence, and would you see that as being cost prohibitive? But if you could just explain that part of it also in a bit more detail.
Absolutely, yeah. Our current experience in relation to rat mines, volume is relatively low. This isn't a huge kind of demand in relation to the general guests that come into the premises. But there is a cohort that definitely like to have a drink, a glass of wine or some beer before or after film. So in relation to demand, we see huge demand in relation to operas. We are big believers in live streaming of operas, of ballets. Our location in Dundonald, we've sold out shows for all of our live events that we show in Dundonald. We expanded that out to Bangor. We've have it in Lisburn as well. So there's huge demand in relation to that. People like to sit down and watch a live opera and have a glass of wine. In the general scheme, of guests coming in, to give you just an idea in relation to numbers, about 25% of our audience we'd categorise as kind of family audience. The remainder is roughly split equally between kind of couples attending, and then the other half of that is friends and people attending just with friends and whatnot. So near over a third of our business is kind of date night element. Vast majority of our business comes in the evening time. Monday to Friday. 80 to 90% of our business is kind of 8 p.m. to 9 p.m. At the weekends, it's obviously family orientated. Up until maybe 5 p.m. On Saturdays and Sundays, and then it's evening orientated from kind of 8 p.m. on the weekend. So the huge proportion of our business is related to the evening time and is related to kind of date nights, if you want to call it. Attending as well as friends, and they would like possibly to, not everyone, but I think there will be demand in them liking to have a drink of alcohol prior or after cinema or during the cinema zone.
Okay, thanks, Paul. Carol, have you anything you want to add?
Yeah, as Paul said there, I'll probably touch, Paul, if it's okay with you, I'll touch on the licensing side of things. The way the cinemas operate, we're on a cinema license, which we do yearly, where we do that with the local councils. We're very good terms with them, and basically for us, the sort of license we're looking for, we aren't looking for a bar license. We're looking for an entertainment license, and basically a cinema license is covers everything in the entertainment one apart from alcohol side of things. So we would be saying that it would just be any of the premises that wanted to have to give the opportunity of selling alcohol would go to the entertainment license. You'd have an entertainment license, and those that we didn't have would just be a cinema license. And just to say roughly, a cinema license costs between smaller cinemas between £350 to £650 a year, which covers your fire risk assessment, your emergency lighting, etc., etc. The entertainment license would be, and these are approximately about around about £1,200 a year, and in that you would be talking to the council if you wanted to have alcohol, the days you were looking to do it, and the time. That's how I would see that we could link in quite easily with this.
Okay, thanks, Carol, for that as well. I have Sinead waiting to come in. Any other members want to ask questions? Can they please let me know? Sinead, do you want to go ahead? Bring Sinead in. There we go.
Yeah, thanks, Chair, and thanks to Paul and Carol for briefing us this morning. I suppose it's we had a similar briefing last week, and I suppose my comments aren't really so much questions, but Last week's briefing, I think, really opened my eyes, because I've thought for a long time that cinemas are in real danger in terms of people's viewing habits, and we know a lot of films are going straight to Netflix now. They're going straight to Amazon. They're going straight to Disney, and people can watch those from their own homes. So I suppose it's a case of trying to think of ways where we can encourage people to be more social, to get out. And I think one way of doing that is to change the way cinemas operate. And I think it will be a very progressive thing to do. It would certainly, it would certainly appeal to myself and to people my age who have grown up going to cinemas and who like the experience of going to cinemas. But the accessibility of Netflix and the convenience of Netflix and things like that do obviously make you're thinking, like, why would I go to the cinema when I can just stay in the house and watch something? So I think we do need to fundamentally change the way we view cinemas, or else we're in danger of actually losing that part of our entertainment habit. So I think personally myself, I'd be very supportive of your calls, and I think it's something that this committee should seriously consider in our further deliberations of this bill.
That's great news, Sinead. Thank you.
Yeah.
Thanks.
No, Sinead, I appreciate that. Absolutely. I think cinema in Northern Ireland is, as you rightly put it, is in danger, and is in danger of being left behind. That if we're not allowed to evolve the offering, it does potentially put that taking that step forward in danger. We're cinema runs through our blood. We're very obviously we believe in the cinema experience, but we need to be able to evolve with that and have different offerings that not everyone is going to want, but there are a strong cohort that may look to avail of it.
I think as well, you've in terms of regional disparity, I mean, not everybody can afford to go to Belfast or can afford to go to Dublin to see maybe a theatre show or that, like. So the fact that I know my own cinema locally, Omniplex in Newry, have branched out and have been showing some theatre type offerings, so it does open up that new experience to people who maybe, as I say, maybe can't afford to go to a theatre show in Dublin or Belfast. So it's about offering choice as well, and I think cinema should be supported in doing that.
Can I just say, Sinead, too, you've tapped on it as well, is that the cinema has evolved so much, because it used to be just about films, but now we're alternative content, as Paul's touched on it. We have the ballet and the opera, and it's a bit like, you're paying for a ticket to go for an experience, and we have people coming in, and there's live intervals, and people just, not everybody, but they would like to avail of a glass of wine, starts or whatever, so that it gives them a complete experience of actually thinking that they are in the theatre side of things.
Mm-hmm. Thank you, guys. That's all for me.
Okay, thanks, Sinead. Just before I bring Mark in, I don't know if Paul or Carol, you know the answer to this question. I didn't ask it of Michael last week either. Did our cinemas ever have a licence to sell alcohol at any stage? I know that I'm just asking this because one of my staff members yesterday was telling me that whenever her and her husband were going together, they used to go to the Grove theatre on the Shore Road, and she said the only reason why they went there was because they could have a drink in the interval and things like that. So I'm just asking, was there ever? Do you remember? I'm not saying do you remember, Carol, because you're the same age as me, so no, we wouldn't possibly remember.
Thank you very much for that. Only UK by maybe. To my knowledge, no, but there are different licenses where people can, theatres are under different side of things about how they come in, but to my knowledge, no. There wouldn't be, and I think it's the evolution again of the cinemas, and one of our biggest thing is the fact that we're not listed in the list, and I think that's why we've been overlooked, admitted more than anything, because people haven't realised that originally it was just cinema, it was just watching the film, I mean, now we are offering so much, for the family and for couples and for that, this is where we need to bring it. It hasn't been done before, but this is why we're bringing it to you.
Okay, thank you, Carol. I'm going to move on. I'm going to
The
move.
other one is QFT. Sorry, QFT do have.
They're different because they're a place of education. I'm going to move on to Mark before I get myself into any more trouble. So can I bring in Mark Durkin, please? Mark. There you are, Mark.
Thanks, Chair. Hello, Paul. Hello, Carl. It's nice to see you again, even though you can't see me. Just to say, I suppose, to be sympathetic enough to what you're coming forward with, the suggestions. But I'd like to know, I suppose, what, if any, sort of restrictions to operate would you consider reasonable? For example, if alcohol could only be sold after a certain time of day, or would you like any adult to be able to go into the cinema and buy alcohol, or would they have to be seeing a film?
In relation to restrictions on timing, I think we're open to suggestions. I do think it becomes, confusing as well to the public. If they are entering a building where we are selling alcohol and it's different to whatever the social norms are in relation to, other pubs or licensed premises. What their trading hours are, but we can work around that. I don't think there's going to be huge volume or huge people looking for alcohol early in the day time, i.e., our matinee shows, 12, 2 p.m. shows. But if there is demand, it would most likely be in the evening time. I would caveat that with, we are expanding offerings in relation to conferences as well. And kind of business conferences who may, like to have an offering of some alcoholic beverages, and that may vary at the daytime, during the day as well. But I don't see huge demand for it, in the daytime. If that answers your question, Mark.
Super. And as you know, we had a representative in from Movie House last week, and we did hear it after I'd asked, I have to say, about instances occasionally of patrons sneaking alcohol in. I think 50 Shades of Grey was mentioned as one particularly bad period.
Sex in the City is imprinted in my brain for that. We were clearing a few aisles of rows of seats, and there was a few empty bottles of wine underneath the chairs. But generally speaking, we don't have any issues that I'm aware of, and that they haven't been reported to me anyway in relation to people sneaking in alcohol. It can happen. We serve over nearly 6 million people annually, pre-COVID annually. So we put a lot of volume through our sites, and you're obviously going to get some exceptions with when you're dealing with the public, but the vast majority we have had no issues. Mm-hmm. And in relation to Rat Mines as well, where we do have a license, we've had zero instances of any problems with alcohol. And it's all, cinema is an extremely controlled environment as well. Once you pass our ticket check, you're now in a very controlled environment. And we have obviously good experience in relation to age ratings and allowing people, managing, age ratings of films as well. So, yeah.
Super, Paul. Thank you. Thanks, Carol.
Okay, Paul.
Thanks, Mark. Just before you no other members asked to come in, I just wanted, because I'd asked Michael the same question last week when he was in from Movie House about COVID, and you'd mentioned a few, I know Paul and one of your answers there, we're not looking at what happened last year whenever we're talking about things, we're looking at now 2 years ago. Just the impact of COVID that has had on the cinema industry. If you want to make any brief comment on that before we finish up.
Yeah, where do I start? It's
you said brief comment.
It's we had a record year in 2019, coming into a very strong January and February, and business has just fallen off a cliff. I ran some numbers in relation to April to December of last year versus April to December of 2019, and our revenue is down 92% year on year. So we've been closed for 26 weeks of last year, and so it's been absolutely devastating, devastating to our business, devastating to our employees, and the opening and closing of our businesses, we put a huge amount of time, effort, financially as well into reopening our business. It was heartbreaking to close it down again for a second time, then reopen, then close it down. A financial toll as well as a mental toll, in that has been devastating. And to our employees, our employees have been fantastic during this process, and they're the guys who really, our managers and our supervisors and our general staff have really been exceptional, in adapting and retraining our staff to working with COVID. It's just it was incredibly disappointing to the opening and closing. Recently, and we will be writing to the respective ministers, we've been extremely disappointed that leisure and entertainment have been excluded from the large tourism and hospitality support scheme, which was announced by the Departmental Economy. It only includes 260 businesses within the tourism and hospitality business sector, and it does not include leisure and entertainment. I can't understand why we weren't included. That funding would have been crucial to us, and we are writing to the respective ministers to try and reconsider this and include us. Some of our large premises, and all of these schemes are worked off a net annual value in relation to rates. Are one of our largest premises, an NAV of 330,000, and among other 11 of our 15 premises in Northern Ireland are above the 50,000 NAV. So we operate very large premises with large NAVs, and naturally have very large outgoings just to maintain those premises, even if they're closed. So we see it crucial to get some sort of funding that's scaled and relevant to the size of our premises and other large leisure and entertainment operators. So we're incredibly disheartened and disappointed that leisure and entertainment weren't included, and hopefully we can see that amended, in the coming weeks.
Well, I suppose, that just on that point, and I know that we've gone straight away from the bill here greatly, that's something maybe this committee can also ask that question of the Department of Economy, just to say that around that grant.
Paula,
yeah, go ahead,
can I just say just a quick one, just to ask you on that point, is just if we could have some clarity for the larger businesses here, because we seem to have been missed out from the start of this terrible pandemic back in March, that cinemas and the larger leisure ones have been just grouped together with hospitality. We went from Department Economy, we then went to Department Communities, then we went back to Department of Economy, and we're really feeling that we're being left out, and we really do need this help. And if you could write and just get some clarity, and any assistance would be much appreciated to not just the cinemas but to all large businesses, large leisure and entertainment business.
Okay, no, we certainly can do that, Carol. I'd see Mark, you have your hand up again. Did you want in again? Mark Durkin. Mark, go ahead.
Yes, Chair. Will you beat me to it in terms of us writing as a committee, I suppose, in support of the ask here, or a similar ask in terms of support, not just for cinemas, but for wider kind of entertainment venues as well. But I was just going to ask, Paul, had there been much of a difference or disparity in terms of government support in the south and the north?
Without trying to get too contentious, there has been differences, and there's even differences between Northern Ireland and England, and Wales, in relation to support. One element, there's two main elements of support that we've received. One is in relation to furlough, the furlough scheme, and the furlough scheme is absolutely excellent, but it doesn't support the company. It supports our employees, and we want to support our employees. So just to be clear on that the furlough scheme is an excellent scheme when we're closed. but it doesn't support the company. The company still has outgoings, still has service charges to pay, still has rents to pay, still has electricity bills to pay.
Your employer contributions to pay in terms of national.
Exactly, yeah, and pension contributions as well. So, yeah, and the other scheme was the rates holiday. Now, the rates is effectively a tax, on related to an NAV, a notional rent, so that's not really a support either. That was really for granted that, in normal circumstances, we've no issue paying rates that are fair, but we were asked and forced by government to close our doors. We have no ability to get revenue in the front door. So how could that same government ask us to pay rates? So we've really done what we've been asked to do. We closed our door. We've been closed for 26 weeks, to date, and counting. And we're just looking for some support from government, because we feel, and from the executive, we feel very hard done by, in relation to this. We see very little forthcoming in relation to just general direct financial support, and this scheme that was developed for the tourism hospitality would go a huge way to ensuring that the businesses that are there, large businesses, will be secure and be able to open when the time comes. And we have had very good direct support in ROI, and it's based off 5% of revenue and or business rates and so on and so forth. I don't know the exact details offhand, but there are direct supports related to business in ROI, but there aren't as generous, say, furlough schemes. So it's kind of swings and roundabouts, as well, and there's a lot of differences and nuances to the schemes, but there's no kind of substantial direct support scheme in NI, which is disappointing.
Okay, cheers, folks.
Okay,
thanks,
thank you. Can I, there's no other member has requested to ask anything, and so the committee will follow up on the final issues that you brought up there as well. Can I say thank you both to yourself, Paul and Carol, for joining us today, and for answering all of our questions in detail, so thank you.
Okay, thank you, Paul, and thank you.
Okay.
Okay.
Bye, thanks.
Bye.
Bye. Okay, members, just before I move on, I just want to let you know that the clerk, Janice, had a discussion with the bill team in the department, and they would like to provide some written briefings as we continue to take our evidence sessions on the bill. This is to provide clarification or further information on key issues raised in the evidence sessions in order to assist the process when we get to our deliberation stage. The committee team will alert the bill team in the department as to any issues arising where additional information or clarification would be useful. So it's just that will be going on in the background. It's just to make members aware and just to get their agreement on that, if that's okay. Yeah. Okay. Great. All agreed. Look, thank you, members. I am going to have to stop for a very short comfort break. I know we have two big briefings of the department, and we have an hour left now. So we have, but I'll be as quick as possible, so just take your ease for a few moments.
Committee room 29.
Okay, members, we're going to move on then to agenda item 8, which is a departmental briefing on the JobStart scheme. Members, you'll find the departmental response at page 41 and a letter from the Minister and additional briefing paper received yesterday in your tabled papers. Can I welcome to the meeting Deirdre Ward. Deirdre, I know you've been hanging around for a very long time as well, listening in. Deirdre, can I ask you to go ahead and do your briefing as brief as possible as well? Be allowed time for some questions. Thanks, Deirdre.
Yeah. Thanks for the opportunity to brief committee. So, as you'll be aware, COVID has had an unprecedented impact on the local economy and on the labour market. So we currently have approximately 60,000 people claiming unemployment benefits, those searching for work under Universal Credit and Job Seekers Allowance. And we anticipate that to rise to 93,000 in May this year after the COVID job retention scheme ends. There's also comparable numbers in Northern Ireland claiming support for the self-employed income support scheme, with 70,000 claims. And there are 68,000 currently on furlough. The JobStart scheme was designed to respond to the needs of young people and those who are work ready, and that's ready who to be re-employed but need help negotiating the process of finding work. When I spoke to you in December, we were geared up to launch the JobStart scheme on the 14th of December. The online application process for employers was set up and ready to open. Staff were in place to assess the applications as they were submitted. Work coaches were in place to work with young people to determine which job opportunities they should apply for. And my team has continued since then to refine the processes for JobStart while we await a date to launch. Discussions have taken place with colleagues in Department for Economy about using JobStart as a pathway into an apprenticeship or into other training initiatives. The departmental bid to DOF as part of the budget 21-22 exercise was for 24.7 million to support the delivery of new and expanded labour market interventions this year. When the draft budget was shared, it became apparent that the settlement provided for the department had no COVID allocation to address the need for labour market interventions to support people into employment. And this includes JobStart, our expanded work experience schemes, our increased flexible support funding, and our work-ready employability service. As a result, the Minister was advised to pause the launch of these interventions. The Minister has engaged with the Finance Department and other executive colleagues and is committed to getting Job Scheme up and running as soon as possible. The Department reallocated internal funding to meet the costs of launching JobStart scheme, but to date no funding has been surrendered to DOF. If funding can be confirmed for 21-22, we can open the scheme for applications from employers. It takes approximately 3 to 4 weeks to process an application for funding to ensure the checks have been completed, for example, on the financial viability of an employer. When an employer has been successful, a funding agreement will be shared with them. This is returned having been signed off with the employer along with the specific details of the jobs they have available. Then recruitment for the opportunities can start. Work coaches can talk to young people about what jobs are available and the employer can start to receive applications. It's envisioned that this process would take around 6 weeks. So overall, there's a lead time in around 9 to 10 weeks before a young person is actually placed in an opportunity from the scheme launches. But as we said, we're unable to launch at this stage because we have no funding from the 1st of April next year. I would say as well that we're frustrated that we can't launch these labour market schemes because we believe these are the right kind of schemes to help young people. The Minister is equally frustrated and committed into trying to seek budget clarity to help us move forward. But I'm happy to take any questions from committee members.
Okay, look, thank you, Deirdre, and you will know yourself, because I'm sure you've listened into this committee and heard just how frustrated the committee is also that this scheme did not start on the time frame that had first been anticipated, and indeed we know that the similar scheme, I know it's not exactly the same, but a similar scheme started back over in mainland UK in the beginning of September, so that's 5 months of loss of jobs for many of those young people and for many of those employers as well, because not only have we been, I know certainly in my office about this, I've been contacted by employers as well who were ready to start this scheme and find that, you know, this has been most unfair. So we know that we got the money through Barnett consequentials, and if I am right, then that money had to be bid for this. At the time when that money was being, the bid was being put in, you know, the future of this scheme, was it looked at that time? When did the issue around the finance going into the following financial year, when did this issue arise? Deirdre, can you tell us that?
Yeah. So we built business cases for all of the labour market interventions that we were doing, and we submitted those, as is the process, through our department and then into GOF. Those business cases were all approved, and we had the in-year money to launch the schemes. But these are, JobStart in particular gives young people opportunities for 6 months to 9 months. So to start a scheme when we're not clear that we have the money from the 1st of April would be, unfair, I think, on the young person who might only get a few months of a scheme, and or unfair on the employer who's not getting the full opportunity to see what the young person can do. So we only became aware when we understood that the draft budget just around Christmas time didn't have allocations in for next year. But at that point, that was only a first version of the budget. It hadn't been agreed. And so really it was when we saw the draft budget published that we realised there is absolutely no allocation for labour market interventions from the 1st of April onwards. So we're unable to launch.
Okay, and thank you for that explanation, and I absolutely understand that explanation. Can you then maybe enlighten us as to why it took so long for the creation of something that was going to be more bespoke to Northern Ireland, why it took so long to create that? And also, you'd said there about that at this stage no funding has been surrendered. How confident are you, Deirdre, or that you know of, how confident are we that that money will not have to be surrendered?
We have the money in year to do labour market interventions. What we don't have is the money beyond the 31st of March. We could still launch JobStart this financial year if we knew that money would be available in the next financial year to run it. So we're confident that we could launch, for example, JobStart this financial year if we had an understanding about next year's financial position. In terms of the time taken to design and develop JobStart here, DWP had Kickstart launched earlier, but even they have had small numbers of young people actually placed into schemes at this point, partly to do with the restrictions that exist everywhere. And so some of the sectors that might wish to avail of JobStart, not all, but some, would have difficulty placing young people with the social distancing, the need for safety of young people, the need to train young people to take up the job. So uptake has been slower than DWP anticipated in the first instance due to the necessary requirements to meet health guidance at this point.
Okay, look, Deirdre, thank you for that. I'm going to open up to members if they have any questions. Yes, I've got Andy, then I've got Kelly, and then I've got Mark. And just remind members if you can be direct to the point, and also Deirdre. Go ahead, Andy.
Deirdre, I know you confirmed this previously. Can you just remind the committee how much is currently being held for JobStart in this financial year?
We have the staffing in place. We wouldn't anticipate having to subsidise employers in this financial year on the basis that I described there's a bit of a lag time from us processing an employer's application to the young person starting on the job. We want to ensure that when the young person starts, that's a real job and a real opportunity, and that there's been no displacement by an employer, either furloughing or making others redundant in order to take a young person in. So there's a bit of process around checks and balances before the young person would actually start the opportunity, and then payments would be made to employers. So we wouldn't anticipate, bearing in mind that lag time that we're nearly now into February, that we would have to make payments to employers in this financial year, but we could still take those applications and process them to be ready to have young people start in April.
Okay, so let me phrase that slightly differently. Has there been any cost incurred for JobStart in this financial year? I think you previously indicated when you were at the committee before about 0.8 million, if I was right.
Yeah, so we have costs incurred this year because we have had to have staff develop the scheme. We've had to train staff to understand how to process applications from employers. We've had to develop guidance for the work coaches on the front line so that they understand what the processes are. And we've had to set up processes in terms of respective payment with employers. We've also done a lot of staff engagement with out to organisations and to employers and to employers groups. And so that has all been done by staff. So yes, there have been staff costs incurred in this financial year.
Do you have a figure on that?
It's under £1 million, but I can't tell you off the top of my head. What I will do is write to you after this and give you the exact number.
Okay, and can you confirm then, I think you'd mentioned in around circa 24 million for workforce intervention.
Yes.
How much of that is required for JobStart?
17.7 million.
17.7. And I don't know if you'll have this information or you can obtain it. If we had have rolled over Kickstart as was implemented by DWP, what would the cost of that been? And I appreciate obviously the Minister's built in additional safeguards, but do you know?
No, because JobStart is a more fulsome scheme than Kickstart. As we discussed at the committee hearing in December, we were allowing 9 months of training for young people who came from a care background, the youth justice system, or had disabilities. So that isn't available in the Kickstart scheme. So JobStart is probably slightly more expensive than Kickstart would be, but in direct terms, but you're not quite comparing apples and apples. Our scheme is more robust.
No, I appreciate that. I'm not being flippant here, but at the moment we have no start. That is the reality of where we are.
Yeah.
We don't have any scheme. Moving on, and as the chair has pointed out, you know, I too am being contacted by many people who are saying in other regions of the UK they can avail of a similar scheme, but in Northern Ireland yet again we cannot avail of any scheme, and that is not criticism of yourself. It's just to echo the huge frustrations there are out there on the ground, and I think this needs to be resolved.
Yeah.
Thank you, Deirdre.
I share your frustration. We believe this is a really good scheme to give young people an opportunity in an absolutely devastating economic downturn to move forward, to acquire the skills they need to access the labour market. So yes, there were Barnett consequentials that came across, and we're as frustrated as anyone that we can't launch this scheme, because we believe firmly, as does the Minister, that this is the right thing to do.
Sorry, just very quickly, Deirdre, are you in a position to confirm what the Barnett was? I think you confirmed that previously. It was about 17 million, was it?
No, it was in total for labour market interventions. It was more like 35 million, and what we were bidding for was 24. But let me confirm those figures for you very exactly to be sure.
So of Barnett consequentials, you believe there was in around circa 35 million?
We were asking for less than came across, yes.
So DOF is allocated nothing of the Barnett consequentials, and I do appreciate they're unhypothecated, but not one penny has been allocated?
No, not one.
Yeah, I don't think I need to say anything in respect. I think it speaks for itself. Thanks, Chair.
Okay, Andy, thank you. I'm going to move to Kelly, and again remind Kelly also to be to the point and as brief, please.
Thank you, Chair. Deirdre, thank you very much, and I appreciate you're here on behalf of the department. So I'm going to ask some quick questions that may be quite pointed, but this is not personal. You mentioned at the start 93,000 people are expected to be unemployed in May. What percentage of that amount are these 16 to 24-year-olds?
I'm not sure off the top of my head, Kelly, but I can tell you that youth unemployment currently is running at 11.7%, where pre-COVID it was at 2.5%. So that's already where youth unemployment has gotten to. So I would expect that 11% may rise.
Yeah, I'm just thinking. Yeah, we have a cohort
of young people of 24 and younger. Yeah.
I'm just thinking that there's a cohort of young people who really haven't had any opportunities to complete their education at this stage, who will be coming out of education in May and June time. Are they included in your thoughts at this stage, or that 93,000, or is that separate?
No, that would be separate, because normally they're leaving education in that sort of June time frame. And so they're not in that modelling for the 93,000 is my assumption.
Okay, thank you. I'm a little bit confused, Deirdre, and I believe that the committee has been misled and MLAs have been misled. We were told, as you know, that we were ready to go on the 14th of December. You're saying to us that the scheme, disappointingly, absolutely, we're as frustrated as you are, cannot go ahead now because we don't know what the funding situation will be from the new financial year in the 1st of April. But surely that was known on the 14th of December. We were told that the reason why the scheme didn't go forward on the 14th of December was because of lockdown, and that there was no point in taking it forward at that stage because employers and young people wouldn't be able to avail of the opportunities because of lockdown. I'm sort of being led to understand now that that's not the case, that it's more to do with the money. I appreciate that there was a bid made for the Barnett consequentials and the department wasn't successful in that. It was used for many other purposes. But my concern is, for instance, the Work Ready Employment Service has been brought to my attention that people bid or put it forward their tender applications in November and they still haven't heard anything. So even if we wanted to flick a switch and make this scheme available, those tenders haven't been evaluated and no awards have been made. I'm also, I'll ask this question and this will be my final one. I am a disability advocate and I am absolutely furious that I have a concern that people with disabilities and the programmes that could have provided them with support are going to be left high and dry from the 1st of April because the presumption was that JobStart would have included those young people. It's not going to now. What's the plan B? We know that the Shared Prosperity Fund is up in the air and it's not going to be able to be used in the same way the ESF was before. Are we looking at a year's worth of people with disabilities not being able to access employment opportunities because this scheme and other schemes are not there?
On the disability piece, we still have our existing provision and we still are moving forward with that. So we still continue to offer access to work and condition management programme and work. And so those pieces are still moving forward and still being delivered, and those are specific schemes to help people with health conditions and disabilities.
Can I just ask you on that one? We're coming very close to the end of the financial year. The suppliers for those schemes, are they in place? Have they been given grants and contracts for the coming year?
Those schemes are contractually run across a number of years, and those schemes are still in place and will be in place as we move into the next financial year. Those are within the baseline allocation that we've been given. What I would say to you is, and I'm happy to come back and brief further in this committee, those schemes are up for contractual finish in the middle of next financial year, and so we have been working to understand what comes after those schemes in support of those with disabilities and trying to think that through. And so those schemes will run until they're contractually finished, and then we will look to understand what is the new provision that comes after that that is specific to disability. So that would be what we would be doing in the disability space. In relation to your early question about December, we had outlined business cases for JobStart and all of the other pieces of labour market intervention that we talked about, and those went through DOF very late on in November, early December, and they were all approved. So we didn't have an indication that the bids wouldn't be met, and we had our in-year money to move forward and launch all of these labour market interventions. So I have to say we were really shocked when we realised those bids wouldn't be met, because that was not our understanding, having gained approval for the business cases from DOF.
But I just want clarification then. At this stage, we're saying that there's a question mark over the money from the 1st of April. I understand just work back with me. So on the 14th of December, if the scheme had have opened, and it takes 9 to 10 weeks for the process to complete, allow those young people to be able to, now given the fact that we didn't have a scheme that was open for businesses to actually apply at that stage, and it would take them 3 or 4 weeks and then 9 or 10 weeks to get their recruitment done and get those young people, we were always looking at the 1st of April. So I'm just wondering, just on that timeline then, if we weren't sure that the money was going to be there from the 1st of April because the budget bids weren't there. Could this scheme ever have begun in this year?
Well, no, it could have begun. We weren't thinking that it would be April before people would young people would start on the scheme. Our feeling was that if we got our processing speeds up and became more experienced in processing the applications from employers, that we might have young people feet on the ground, so to speak, towards the end of February and into March. So it wasn't our expectation that it would take to April to have young people actually start in opportunities. That all along we've understood that there's a real need to help young people to access the labour market. We were always going to go to as fast as we could to get young people into these opportunities, because we're clear about the timescales of more young people leaving education in June of this year. We're clear that anyone who was made redundant in March of last year is about to hit 12 months unemployment in March of this year, putting them into the long-term unemployed category. So we understand the timing of interventions being crucial as well.
Yeah, I'm just very concerned that, the rest of the UK with Kickstart, as Andy has said, this is horrendous. This is not of anybody's making. The pandemic is the fault. COVID is there and we're stuck in this situation. But the rest of the UK moved forward. We were told that JobStart would be a wonderfully more inclusive scheme, and it sounded fantastic. But as Andy has said, it doesn't matter if it sounds fantastic if it's not on the ground to be able to deliver. I'm just very concerned that there are other aspects of this scheme, like the Work Ready Employment Service, where the tenders haven't even been sorted out yet. Those suppliers are sitting going, are we ever going to get an answer on this? We applied months ago. Things have changed, times have moved on. I just wonder how viable those quotes were included in their tenders now. But it would be very good, Deirdre, and I know this is not all on your head, it's a myriad of circumstances, but we're kept up to date as soon as possible, any changes that come forward, because I'm terrified of this. I could see our 16 to 24-year-old, and we have a number of who are leaving school, leaving universities because they're so unmotivated now because of this whole pandemic, and we're faced with a year's worth of trying to put this back together again. But any updates would be wonderful. Thank you, Chair. Thank you, Deirdre.
Okay,
Thank you.
Thanks, Kelly. Then I'm going to move on to Mark Durkin, and again remind Mark if he can bring his questions to a point.
I will be brief enough, Chair, because most of it's been covered, and I welcome Deirdre, and I know, Deirdre, it's never easy to be the bearer of bad news. And I suppose, like Andy referred to this as no start, I think false start might be a better term. And I know a couple of my colleagues have mentioned this already, but I just want for full clarity. We were told before Christmas by the previous minister that the delay to JobStart's launch was due to the fortnight circuit breaker. Was that fully the case, or was there any indication at that point that the necessary allocation wouldn't make it under the budget?
No, we were not aware that there was that the necessary allocation from the 1st of April wouldn't be there. The circuit breaker decision, one of the biggest interests from employers was some of the bigger retail sectors who have been extraordinarily busy over the COVID period, and from other employers who were keen to take young people in. But the circuit breaker was going to make that difficult in relation to still observing health guidance while getting young people trained to deliver in a new job. So it was the right thing to do. DWP would say as well that Kickstart has had a slower start than they would have liked in relation to the restrictions, making it difficult for employers to bring young people in the numbers that they would like to, in the opportunities that they want to offer, alongside making sure that everyone is safe and keeping compliant with the guidance.
Thanks, Deirdre. And then could we just have some more detail on what work had been done up until this point, I know Andy had touched on that as well, but like, I mean, was it the case that there were any, or if so, how many employers lined up to employ young people? How many young people were we anticipating would engage in the scheme? And how have they been informed of this disastrous development?
Well, we had engaged with like over 400 or 500 different organisations in order to get people to understand what the labour market interventions might be. So we had been speaking to councils, to employers, groups, to sectoral groups, and in geographies to try and engage with employers. And we had indications from quite a number of employers, including some big employers, that they would be keen to take people into JobStart opportunities. So there had been a lot of groundwork covered to warm up the employer marketplace to the opportunity, and also a lot of work done with our front line to help job coaches understand what the offer would be, so that conversations could then begin with young people. So yes, you're right. We did have considerable interest from businesses wanting to take young people in the JobStart opportunities. And now we are going to have to do a very comprehensive and robust communications in the opposite direction, which we're very frustrated by, I have to say.
No, I'm certainly sympathetic to the fact that yourself and your colleagues have put so much work into this, and it seems to have all been in vain, but to reserve most sympathy and lots of it for those young people whose hopes may have been raised and have now been just cruelly dashed. But thank you, Deirdre.
Okay, thank you, Mark, for that. Alex?
Yes, thank you for your presentation. It's very disappointing to hear all this. Am I right? Is it 24 million you need to go into next year?
Yeah, 24 million. Sorry, 24 million for all of the labour market interventions, 17.7 for JobStart, so 24.6 for all of them in total.
And the department put in to the finance department for this extra money?
Yes.
And was it the finance department that turned it down?
There's no allocation made for it in the draft budget.
Yeah, so, but you put the application forward with the minister to the finance department, and it wasn't taken forward from there, was it?
The way it works, finance colleagues are next after me, I know, but the way it works for us is that we build a business case and we take that through approvals within the department, and then it goes to Department of Finance for approvals. Those business cases for all of those separate labour market interventions adding up to the 24.6 million were all approved by Department of Finance.
Okay.
Then there was no allocation against those bids in the draft executive budget that is out for consultation.
Yeah, but the budget was brought forward by the finance minister, isn't that right? Yeah, wasn't it?
Budget. Yes.
Yeah, everybody's saying yes, and you're saying yes, yeah? Yeah, so he didn't bring it forward, basically, is what you're saying.
Well, I think it's the executive's draft budget, but certainly the approvals have been in place for the business cases, yes, by finance.
Yeah, so the finance minister hasn't brought it forward. Was there any discussions between the Minister for Communities and the finance minister?
The Minister for Communities has had discussions, bilateral discussions with the Minister for Finance, and continues to press for the needs for budget to cover labour market interventions, and is extremely committed to wanting to try to secure the necessary finance for us to launch these schemes and move forward and help people into work.
Don't worry, I'm not blaming the Communities Minister, I'm blaming the Finance Minister for not bringing this forward to the Executive to bring it forward. So, okay, thank you very much.
Okay, Thank you, Deirdre, very much. You will definitely have got an insight into our frustration around all of this. I think it was compounded last week whenever we only heard about the finance issue when it came to question time in the chamber, which, you know, just added to our frustration. So, as I say, we're not blaming you in any way, shape or form, and thank you for coming along and giving us this briefing. And we're quite conscious, yeah, we do have a departmental briefing on the budget afterwards, so there might be some questions asked within that as well. So thank you, Deirdre, and we'll be watching this one with interest, as you'd be aware. All right.
Thank you. Thanks.
Thank you. Bye-bye. Okay, members, I see Kelly's hand has just gone up. I hope I didn't miss her there, or she put it up after, but we're away on anyway. So we're going to move on quickly then to agenda item 9, which is a departmental briefing on budget 2021-22. Members, you'll find this at page 43 of your pack. And you'll find additional in your table papers a letter received yesterday from the department regarding January monitoring round, new bids and additional reduced requirements. Members, I'm really conscious that we have very little time left, and normally anything to do with budget we spend quite a bit going through it, but we will motor on. And again, just ask everybody just to be direct and get to the point. Can I then welcome to the meeting Gavin Patrick and Cherry Arnold? You are both very welcome. There we go. You're both very clear. Would it be maybe better that if we went straight to questioning, or if you wanted to just give us a very 1 minute brief if you have anything you want to say beforehand? I'm just very conscious of our time frame today.
Thank you, Chair and Committee. I suppose just to set out then the key points of the budget. The budget was agreed by the Finance Minister, announced by the Finance Minister on the 18th of January. It's now subject to Department-led period of public consultation, which runs to the 25th of February. It presents very challenging aspects for the Department in the 21-22 financial year. In terms of key impacts, our budget proposed is 824 million of resource. This is only 1 million additional on the 2021 opening position, and is effectively 1.5 million less on 2021, as no recurrent funding has been provided for independent advice for work previously carried out by the advice sector and supporting welfare reform change. Our bid for 18 million for baseline funding for pay and inflationary pressures has not been met. A further bid for 149 million for COVID funding has also not been met. This will have significant impacts in terms of welfare delivery. We had plans in place to recruit 900 additional staff to pay working age benefits in light of increased demand for social security. This work is now currently being scaled back and will focus on filling only a very limited number of vacancies. To set this in the context of the current pandemic, the universal credit caseload has increased by over 126% over the past 10 months and is expected to increase further as the furlough scheme ends. Also too, as Deirdre mentioned in your previous briefing, we've received no funding for our labour market interventions. There will also be significant impacts on the arts and sports sectors. Bids again for these sectors have not been met. The same applies too for councils and our supporting people providers. There's also too impacts on homeless people, as throughout the pandemic we've provided assistance for more emergency accommodation to reduce the numbers living on the street. Again, our bid for homelessness has not been met, and these urgent interventions will not be funded and may likely reduce or stop. We also had bids in for New Decade, New Approach for 139 million. Only our bid for existing welfare mitigations has been met, which means bids totalling 96 million have not been met. These included bids to deliver new welfare mitigations recommended by the Northern Ireland Human Rights Commission, a bid to support amending the special rules for terminal illness and removal of the welfare reform to child policy. A number of other bids, including bids for the Irish language and Ulster Scots strategies, disability, gender equality, sexual orientation, anti-poverty strategies have also not been met. We bid for 8.4 million to impact the negative consequences on homelessness and vulnerable households for EU exit. Again, this bid has also not been met. The department bid as well too for 3.1 million for housing transformation. Again, this bid has also not been met, which will impact on our ability to bring about the Housing Executives Revitalisation Programme. To summarise in terms of resource, the department bid for 318 million of resource for baseline requirements, COVID recovery, New Decade, New Approach, housing transformation and Brexit, and received only 42.8 million for existing mitigations. In terms of capital, the department bid for 329 million of capital and was allocated 224. Our application is a 10.7 million increase on the capital funding provided for the current financial year. This allocation will allow the department to meet its statutory obligations, such as housing disabled adoptions, renovation grants, discretionary support loans, funeral loans and health and safety requirements. In terms of financial transaction capital, the department has secured 38.8 million, and that will support the co-ownership housing scheme in 21-22. As part of the budget consultation, we carried out an equality impact assessment, and the draft has been published for public consultation. And this is due to the impacts that our budget will have on our Section 75 categories. It will impact on people of different ages, particularly young people, given the fact that we will have limitations in terms of the labour market interventions we will be able to have in place. It will also impact on men and women. It's likely to impact on people with a disability who will now be even further from the labour market. It will also impact on people with dependents, as households who are on benefits such as universal credit are likely to experience delays in payments. The department's public consultation runs concurrently with the Department of Finance-led public consultation on the executive budget until the 21st of February. To summarise, the impact of the executive's draft budget on the department is very challenging. We have a very strained financial position in the 21-22 financial year. At the minute, we are urgently considering options on how we live within the budget that has been allocated. These options may include not filling vacancies and considering how efficiencies can be realised across the department, across our arm's length bodies, our programmes of work. However, this will be very challenging given over 92% of the department's resource budget is required to meet protected, contractual, inescapable and statutory obligations. And developing options to live within their proposed 21-22 budget allocation, consideration will be given to how any adverse impacts can be reduced. However, this will be extremely difficult given the scale of additional funding the department requires next financial year. Our Minister continues to lobby for additional funding to support those people who need it most, and the engagement continues with the Department of Finance. Gavin and I are now happy to take any questions.
Okay, look, thank you for that, and I'm just going to go straight in. I'll just ask two questions and then I'm going to go straight to members, and I have Sinead, Kelly and Mark waiting to ask questions. We've heard, and you would have heard there, you were sitting in or listening to our previous brief there to do with the JobStart scheme and the issue around funding. For that, we had an issue at the beginning of the meeting, albeit it wasn't funding from this committee, it was funding from other committees that rolled throughout this committee, who haven't heard whether their funding will go on past the 31st of March. And we know that much of this is, a lot of this it will be executive decisions that are made. Do you see, looking at the Department for Communities, all of those wonderful projects that we have in place, are we looking seriously now at many of those projects having to end?
In the absence of funding being available, yes, that is the situation that or the funding not being provided, that's the situation we're now in. In terms of labour market interventions, yes, it will impact on our statutory obligation to support people, particularly young people that have been impacted by COVID. You'll have heard Deirdre mention young unemployment amongst young people at the minute is now sitting at 11.7%. In that age bracket up to 24. It's also likely to impact on disabled people who are now further from the labour market. And we also too, I know Deirdre mentioned the 24 million for the labour market for the new programmes we were due to launch. We also had a further bid in for 12 million for a restart, in line with the Department of Work and Pensions and work being progressed there, and that was to support long-term unemployment. And without that additional funding, we will be unable to progress these schemes. It's also too going to have negative impacts as well too on the department's AME spend. We're not going to be able to help people move into work and reduce their dependence on benefits. And again, it could lead to potential financial penalties from Treasury. And it does mean that without a response in Northern Ireland, we will be the only region in the islands that is unable to support people in the middle of the biggest economic crisis we're currently facing.
Thank you for that. And just a quick supplementary onto that. We know certainly that through the department communities, you're supporting the most vulnerable within our society and people who are in absolute real need. Are other committees having the same difficulties around funding as or other departments rather, as the Department of Communities? Is this even across the board?
If I come in there, Chair, all departments were receiving their opening baseline was in line with their opening baseline for this current year, 2021. So I would say all departments are facing very difficult decisions like ourselves. I'm not aware at this point of any others that are in the position of publishing or going through an EQIA exercise. Therefore, it would appear that we are maybe are impacted further because of those three areas highlighted in that EQIA.
Okay, thank you for that, Gavin, and I'm keen because there's lots of questions to be asked to move on. The other one I would just want to ask you about is the COVID resource spending and the significant amount of money that came from Her Majesty's Treasury at the end of last year. And we know that the Department of Finance is seeking flexibility in carrying some of that money, carrying the money over into the next financial period. Just to ask then on that, if that is successful, has it been planned within the Department for Communities? Are there any plans for that money and how it can be used?
If I go first on that, yes, there are, and we bid within as part of the 21-22 exercise for a number of different schemes, including the labour market interventions and the welfare staffing, and for our other sectors that we support. But those bids haven't been met at this point. However, we are continuing to work with our DOF colleagues to press for that funding for the department, because we recognise at this point we've had £270 million this year in our budget for COVID. But as it stands in the draft budget, we're starting with zero for 21-22 for COVID specific schemes.
Okay, look, thank you for that as well, Gavin. I would love to be able to ask you lots of supplementaries around both of those, but I really am conscious that there are other members who are waiting to ask questions, so just remind members if they would do the same grace as well when they're asking questions. So I'm going to go to Sinead, then Kelly, then Mark, then Andy. So Sinead.
Thank you, Chair, and thanks to the officials. Listen, I think we're in a very dire situation, and I think that we've been dealt a bad hand yet again by the British government in the fact that the Department for Finance can only provide flat budgets to departments, the fact that we still don't have multi-year budgets, and also the fact that we got the budget late. We're now seeing the outworkings of all those issues in the briefing. In terms of the labour market interventions, the fact that we didn't receive any is inconceivable. As well, I know in the briefing there was mention to staffing, and we're already sub the number of staff required to effectively deal with social security. And when furlough ends, that number is going to rise, and it's going to have a massive impact. Sheree, you talked about the equality impact. That's going to be huge on vulnerable people, women, the elderly. So I suppose, and I don't really have a question, but I have a proposal, and it's my understanding that the Communities Minister has written to the Department for Finance about the precarious situation that her department is facing in terms of the budget. And I propose that this committee similarly write to the Department for Finance and support the Minister in her calls for additional funding.
Yep, Sinead, I agree with that. That absolutely agree. Is it okay if we move on, Sinead, after that?
Yeah.
Okay.
Yes, thanks.
Thank you. Thank you very much for being brief as well. Kelly? Bring Kelly in, please. Kelly Armstrong. There we go.
Sorry, Chair, I know I don't have control over my mute button, it's someone else. I'll be very quick here. Obviously, there's a lot of pressure. This is horrendous budget, and I'll be very honest, having worked with departments over 20 years, I sincerely hope that this isn't an attempt to put pressure on everybody else to say that this department is under more pressure than anyone else. I've had experience over the years of other departments playing that game, but if this is honest to goodness the way things are sitting and that there hasn't been a discussion with the rest of the executive to share this out, then this is very concerning. What I would say is the current COVID funding, if you're looking for suggestions, can we ask the department to review the discretionary level of discretionary support and take the break off and the barriers so that people who are applying can actually get access to that money now when there's domestic crisis happening. What I wanted to ask you about, there has been one particular one that I'm extremely concerned about in the unsuccessful bids so far, that the special rules for terminal illness, there doesn't appear to be any money going forward, so that people who have been told that they're fast-tracked onto benefits. Can you just confirm if that's the case? The other thing I wanted to ask about is this budget, horrendous as it currently stands, means that there's an awful lot of new decade, new approach projects that should be taken forward I assume will not happen. For instance, the review of arm's length bodies. And I have to ask, whenever times are tight, we ask the community and voluntary sector to look internally to be as efficient as possible. What internal looks are happening within the department to ensure that all arm's length bodies and the department itself is as efficient as possible with its own costs? I appreciate that there has been problems with the recruitment for people to help handle all of the benefit inquiries. That will continue, but is every other part of the department as efficient as it could be? Because why should people on the front line, those people who are already in poverty, have to bear the brunt of this whenever the department could be sitting quite comfortable? So I just want to ask also about if you could clarify the financial penalties that you've talked about coming from the Treasury with regards to the AMI spend and people with the unemployment schemes.
Yes, Kelly, I'll take that one. In terms of terminal illness, our Minister is absolutely committed to bringing forward proposals to change the 6-month criterion for special rules. We bid for £2 million to change that 6-month criterion to 6-month criterion. Our bid, as you know, it wasn't met. Our Minister continues to lobby for the additional funding, and in the absence of that funding being forthcoming, the department is considering options on how it could meet that requirement. But that is a recurring funding requirement every single year, because that is a payment we would have to make. And obviously DWP, they were set to do this too. Their timetables have slipped as a result of COVID. But our Minister, I can give you assurance that she's still committed to bringing this forward. In terms of, you mentioned there about arm's length bodies and ensuring efficiencies, what are we doing? Right across the department, we are obviously now carrying out an urgent exercise to look at what potentially could be stopped, what could be paused, what could be done differently. That will give consideration right across the department, not just to the benefit areas of spend, but to all areas. That includes our arm's length bodies, and it does include our programmes. However, I have to, say that anything we come up with, it's not going to be sufficient to meet the requirement that we need. We need £31 million roughly. That's what we bid for, to recruit an additional 900 staff to deliver universal credit. We don't have those staff in place, and even that was a bid that went out at a point in time. We have a very robust resourcing system in place, so that it's based on Treasury methodology and how we resource a frontline business, because it's measurable work. We, at the minute, presently, would need around about another 1,200 staff to administer our current universal credit caseloads. We are only coping at the minute because of easements that have been put into the system by the Department of Work and Pensions. And that includes things like the removal of face-to-face, identity verification as well too. And that's also allowing us at the minute to put out 96% of new claims for universal credit within a 5-week time period. Without having the additional staff, and whenever DWP, they're spending 1.4 billion in recruiting 27,000 additional staff. Whenever they secure those staff and they resume normal business, we won't keep pace. It could mean that we see our payment times for new claims slip to only 80 to 85% being done on time, and we could see the benefits move out to potentially a 6 to 7 week time frame for people receiving the first claims for universal credit. And given that given that our unemployment is forecast to increase with furlough ending and further job losses being predicted, this will further impact on the Department's ability to deliver benefits and maintain our statutory obligations.
Thank you for that. Sorry, Chair, just to say that we're already seeing 13-week delays on people being provided their PIP awards. So any further delays on that will just compound poverty across Northern Ireland. That's why I'm very keen that we're as lean and mean as we possibly can be to ensure that those who need to be on that front line are there. But I'm very against we're having such a horrendous year coming forward. Handing back any money should be, completely being worked on now to ensure that we don't hand back money for those people who are in poverty. Thank you, Chair.
Yeah.
Okay, thank you, Kelly. I have Mark, then I have Andy and I have Alex. So still 3 more members that want to ask questions, and we have about 10 minutes. So everybody, including yourselves, Jerry and Gavin, directly, please, to the point. Mark, go ahead.
Thanks, Chair. Hi, folks. I think Deirdre, who was on for the last evidence session, she was the bearer of bad news. You guys are the bearer of a complete bombshell. I would kind of concur with Kelly's experience and analysis. It's not uncommon for departments to put on the poor mouth at this stage and come forward with the worst case scenario, but this is a bloody doomsday scenario, and while I hope it's not a cynical negotiating tactic, I hope even more that regardless of that, it's already causing distress to many. I know people working in the advice sector have been contacting me overnight about this, concerned not only about their own employment going forward, but the impact that this will have on their service users and the people that they support. It really doesn't get any starker than this. I'll quote one bit from the paper there. It's, "We will be the only region on these islands that will not be adequately resourced to support people who face unemployment in the biggest economic crisis faced in our lifetime." So we're shocked, I'm sure, by the decision around the independent advice sector, and that really, really, really does need addressed. I'm sure everyone will support calls to do so. Likewise, on the recruitment plans, they weren't important only to deal with the increased claimants, the huge increase in claimants, the numbers more than doubling, but to create jobs and to help reduce pressure on the benefit system. I was just wondering how many new staff have been recruited since we were informed of the plan to recruit 900. What's the latest with that? I know, I appreciate you said it's going to be scaled back. How far is it going to be scaled back? Also, just the Minister confirmed in an answer to me that the Department's looking at extending the contract with Capita to run PIP assessments for another 2 years beyond the original July end date. I was wondering how much that contract's worth and has money been allocated for in the budget. In terms of the new decade, new approach stuff, and in particular the bids for welfare mitigations, committee has been asking for updates and more importantly action on new welfare mitigations for a year now. The last update we received was the bids for the bedroom tax loophole, the benefit cap and the 2-child policy had been halved because of a delay in introducing legislation. But are we now to understand that these mitigations won't be introduced at all? And does the £42 million set aside for benefit cap and bedroom tax include closing the current loopholes? And then just finally, in terms of the capital bid, and I know only maybe 2/3 of it has been met, is there a capital bid for casement? I know there's a recurrent cost in there for casement, but is there a capital cost? Was there a capital bid? Is that being met?
Okay, Mark, I'll take the first few and I'll pass over to Gavin then for capital. So in terms of the numbers recruited, There was an initial recruitment exercise launched in October, and that exercise was aimed at bringing in an additional 900 staff, plus more. We were also planning to fill their existing vacancies. That exercise has allowed 155 staff to be brought into the department, but those staff are filling existing vacancies. They're not additional staff. As a result of the fact that we've received no confirmation on the funding to ensure that we will be able to pay staff salaries in the next financial year, that recruitment has now been paused. It does mean there's going to be an impact on benefit delivery, but also too we have to consider there's going to be a significant impact on our staff. We already have staff within the department that are dealing with significant increases in workloads. It's going to put them under further pressure, and we could see increased levels of both stress and staff sicknesses. In terms of, you mentioned there about the extension of the capital contracts, that funding was available within the department's existing budget baseline for the current financial year, and that will continue in the next financial year. Costs are running similar. And then, Mark, as well, you had mentioned...
Do we know, will the contract continue or just the funding for it? It hasn't been decided that the contract will be extended, has it?
They will be looking at contract extension.
Okay, thanks.
In terms then of, you mentioned there about new existing mitigation. So there was a commitment in the New Decade New Approach agreement that committed to an urgent review of our welfare mitigations. Our Minister is fully committed to taking forward that review. That review will look at the need, obviously, for further mitigations, and will bring forward a costed future prioritised mitigation package. We bid for the funding to deliver that in the 2021-22 financial year. That bid hasn't been met. However, when those costed proposals are available, they would need to go to the Executive for further funding. In terms of the funding that we have been provided for existing mitigations, that obviously has been received in the current financial year. So we bid for 42.8 million. Our allocation includes 23 million for social sector size criteria. There's 5.5 million in there for benefit cap, and there's around about 10 million in for disability benefits. And it does include funding for closing the loopholes in the current legislation. I'll now pass over to Gavin on the casement query.
Thank you.
Okay, maybe just to cover off the point you made at the start, Mark, and just to reassure the committee, we aren't rolling out the bleeding stumps on these. We've obviously carried out the EKA, and they are unfunded pressures, the labour market interventions and the staffing and the advice sector, as you also mentioned, Mark. We're fully aware of the impact that they will have. And they are unfunded pressures. On the advice sector, we're obviously looking internally and continuing discussions with DOF as to how that funding can be found to maintain that much needed service. In relation to casement, as part of the information gathering exercise in September, which kicked off the whole budget 21-22 process, we identified a potential need of £20 million for casement. That doesn't mean that as part of the overall funding that we've now received that it is 20 million for casement, because as I'm sure you're aware, there's still work ongoing to take forward and to obtain the planning permission to actually get the work on the ground. But we did identify 20 million at that point. That will be reassessed as for the actual need, as my colleagues work with GAA through their development of the draft full business case.
Okay, so just one final one on casement. Given, I suppose, the context in which funding was originally or initially approved for casement for Windsor and Ravenhill or Kingspan as it is now, that was done prior to the awarding of planning permission for either of those projects. Is therefore the success of any bid now dependent on planning permission having been granted?
Well, obviously there will be further discussions, and it has been highlighted that costs have increased given the time frame that has passed since the original monies identified of the 62 million. So what needs to be developed now is a full business case to actually identify the full need for that project, and then further discussions will be taken forward.
Okay, thanks, Gavin. Thank you. Thanks for that.
Okay, thanks for that, Mark. Look, members, at this stage we have 7 minutes left and still got to get through the rest of our committee brief. Now, not that there's too much left. What I want to propose is that we ask Cherry and Gavin to come back next week to our meeting as our first witness session at 9:15. They'll not have to hang around because they have been hanging on the phone for an hour before they even got on to us. We'll take them first, and the first people to ask questions will be Andy and Alex, if that's okay. Could we do, if they're in agreement to that next week?
Can I just pick one question?
Just very quickly, Andy.
Just, Gavin, just on casement, the budget exercise, the total amount that the department's envisaging for casement over that period, what is that in terms of capital?
In 21-22 or
right across the period, the 3-4 year period, what is the total amount that the department has envisaged for casement in addition to the 62 million?
Well, that's what's being worked through in the full business case. So that total amount has to be clarified still, and that work's ongoing.
Yeah, no, I appreciate that, but the department run a budget exercise. In that budget exercise, what have the department forecast for casement?
Let me just pull it up. So, over on I stress again, that was a forecast at the time on part of the budget development. So over the 4 years, there was 102 million.
So 102 million, that's 40 million in addition to the 62 million previously allocated onto the regional stadia programme. So I know you're giving me the evils possibly here, sure, I can't see you, but it's 40 million in addition, and then there's 15 million coming from the GAA in respect to this. So as part of that regional stadia, the public purse could be expected to fork out 102 million on the department's forecast, and I appreciate obviously it's subject to the full business case, but the department has forecast an expenditure of public purse £102 million over the 4 year period.
It was an estimate made as part of that information gathering exercise. Again, I'll stress the full business case needs to be developed to work out the actual forecasted cost. But that was what we had highlighted at that stage back in August, September.
But back in August, September, obviously the department was working on details. You just didn't pluck this figure out of the sky. You were obviously working on parameters, details, information, data, whatever you were using to come up with this figure. This isn't a figure you just conjured up.
No, it wasn't. It was an estimate at that point on the information held at that point, but the full business case still needs to be developed.
So there is an expectation the casement could end up costing, subject to approval, the public purse £102 million.
That was the estimate in September. Again, we need the full business case to develop. It could come down.
Yeah, and sure, look, I'm very keen to pick up the other points next week, because there's, as Mark pointed out, bombshell start. We could use all sorts of different words to describe the budget. Number of concerns, especially around universal credit, terminal illness, etc. But I'll leave it there, Chair. And thanks for indulging me.
No, you're very welcome, Andy. And I'm going to ask the same of Alex. Would he? Well, you have no choice actually at this stage, because I now have 4 minutes left to complete the meeting. So I do. Thank you very much, Cherry and Gavin, and we will have you back next week, and we promise you we'll take you first, and you'll not be hanging around for hours waiting on us, and that way members can then continue with what is really important. And we should have given more time to it today, but sadly we didn't have that time. So thank you. I'm going to move on. Okay.
Thank you.
Thank you very much.
Thank you. All right, and thank you to Andy and Alex as well for understanding that too, that we need to move on. Right, what number am I on, folks?
Correspondence 12.
Correspondence 12. Right, thank you. Bear with me. Okay. Correspondence, item number 12. So, members, you'll find the correspondence memo at page 59 of your meeting pack. I just have 2 items I want to draw to your attention. The first one is a letter from the Arts Collaboration Network, who wish to brief us on their report on the culture beyond COVID. Some of us were in the new APG that has been formed in the arts, and we heard from them there. Can I just say that, can we put that down, if members are agreed, that we are looking at our next stakeholder event is going to be COVID recovery, so can we ask that they come in then to the stakeholder event and brief us? Agreed? Great, good stuff, thank you. The next one, members, is a letter from the Regional Secretary of the National Association of Councillors, who's requested to brief the committee on councillors' issues, concerns and well-being. I very much I do want to hear from them, but at this stage, can I just seek your permission to ask for a written briefing from them first and foremost, because I'm sure at some stage in the not too distant future we will be hearing from Solace as well, so I think we do need to hear from the National Association of Councillors at the stage whenever we're ready to get those other evidence sessions. Member agreed, but we'll get a written briefing first. Yeah, agreed? Okay, yep, good. Great. Thank you. And I'm going to ask any other member have anything they want to very quickly bring up under correspondence. Are they happy to note the correspondence memo?
Happy to note.
Happy to note. Okay, thank you. Then members, item 13, forward work programme. At our meeting on the 4th of February next week, we will be briefed by the following organisations in relation to the licensing and registration of clubs amendment bill. We'll have the Presbyterian and Methodist churches, which is a joint briefing. We'll have Retail NI, we'll have the Northern Ireland Drinks Industry Group and Copeland Distillery, and of course now we've got on the agenda also a briefing again on the budget, which we hope to take first. Any comments on agenda item 13? Happy to note? Yep, so noted. Good. Then we're going to move on very quickly to agenda item 14, which is any other relevant business. Do members have any AOB they need to bring up at this stage, or cannot wait until next week? All okay? Yep. Go very quickly.
Paul, oh sorry, just to say there's a bit of a problem here today with Starleaf. I keep on being muted and not able to intervene. Earlier on when I was waving my hand, I did want us to ask a question of the department, to ask them for a timeline on when they knew the information about JobStart. But there's an issue about when it goes to a wide meeting room that it's cutting out those of us, or cutting out us being able to speak remotely.
Okay, well then we'll look at that, Kelly, because that is I know it maybe is happening in other committees as well, so we'll have a look at that. Okay, I'm going to move then swiftly on to agenda item 15, which is date, time and location of our next meeting. Members, our next meeting will take place here in room 29 next Thursday, the 4th of February, again at 9:15 a.m. Thank you all very much.